Hello, can everybody hear me?
Yes.
Yes.
Hi. So I'm Maite. Maite and Carlos will be the interpreters for tonight. And just wanted to introduce organization Language Justice. It's an organization that has the commitment to encourage everyone to speak the language of their heart, whether it's English, Spanish, or any other languages. We are here to provide a flowed environment. And if you would like to listen to the interpretation in Spanish, there should be on the bottom with all the video, the mute, and all those symbols. You should have like a globe where you can click and choose to hear the meeting in English or in Spanish. And if you have any questions, please do not hesitate to write on the chat or raise your hand and we'll be here to help you. Buenas tardes, mi nombre es Maite y Carlos, somos los intérpretes de esta tarde. Pertenecemos a la Organización de Justicia del Lenguaje y nuestro gran compromiso es de, que todo el mundo pueda hablar con el lenguaje de su corazón y cualquiera que sea ese, ya sea inglés, español o cualquier otro. Estamos aquí para proveer un ambiente relajado y fluido. Los no tienen más que mirar en el icono del globo abajo donde tienen los restos de los símbolos y ahí pueden elegir ustedes el idioma en el que quieran escuchar esta junta, en inglés o en español. Muchas gracias, no duden de escribir si necesitan ayuda en el chat y nosotros les asistiremos. Gracias.
Thank you both for your support. All right, and feel free to, the globe icon should be up now for folks, so feel free to choose the language of your heart. Lindsay, can we now have a roll call?
Sure. Harriet Hall.
Here.
Sherry John.
Here.
Jane Drager.
Present.
For the record, a quorum is established.
All right, thank you. Our first agenda item is our consent agenda, which is acceptance of the agenda, the approval of the Board of Health minutes from December, approval of the Community Health Services fee schedule for 2022, and approval of the contracts and agreements. Can I have a motion to approve the consent agenda?
Motion.
Oh, go ahead. Sorry.
I would so move.
I'll second it.
A motion and a second. Any discussion? All those in favor say aye.
Aye.
Aye. Any opposed? No, it's 3 yeses, so no opposed. Consent agenda is approved. Our second item is the employee of the month for January. Kelsey, are you on with us?
Yes, I am.
Kelsey Campbell,
Oh,
sorry.
Sorry, Kelsey Campbell,
Yes.
sorry. Looking at the wrong agenda.
You are a wonderful employee as well, and we would like to acknowledge you as well, but we're going to highlight Kelsey Campbell for right now.
Yes, I am here.
Hi, Kelsey. Harriet, can you do the honors for us?
I can do the honors. So Kelsey, congratulations. You have been chosen as the Jefferson County Public Health Employee of the Month for January of 2022. This is based in part on the nomination submitted by your supervisor, Donna Viverette, and some of her comments included the following. Kelsey started with Jefferson County Public Health as the Tobacco Prevention Initiative's Community Engagement Specialist in May of 2021, just 2 months after the pandemic moved us to remote work. Despite this causing a major reduction in the ways we could engage with community members, Kelsey got to work immediately to build a stronger network of partners and community advocates. Kelsey's academic background in Latin American studies, immersion learning experiences in Argentina, and her work on policy initiatives in the Lieutenant Governor's Office, along with her deep commitment to equity-centered practices, has helped to move our work in health equity practice from concept and aspiration to operationalization. In the fall of 2021, Kelsey launched a plan to host an event to help community members understand the importance of anti-racist and equity justice-centered work in tobacco control. She invited key partners to collaborate and led a multi-agency effort to produce a community event entitled racist at the root. Kelsey's graceful facilitation skills enabled 5 local public health agencies to come together and produce this event in November, which drew more than 130 registrants from across Colorado and the United States to look deeply into the racist history and practices of the tobacco industry. The effort has helped to draw attention to the need for our grant funders to support deep anti-racist and equity-centered tobacco control policy work. Kelsey was with us just a short time when she began working to build and rebuild relationships with community partners to expand mutually beneficial connections with groups serving historically marginalized populations. She became involved with Jefferson County Public Health's Community Engagement Work Group from the start of this group's process. She also became very involved with the Jeffco Health Alliance, the Colorado Black Health Collaborative, and recently presented to members of the Family Leadership and Training Institute as a starting place to build relationships with Latinx families and other historically marginalized groups. Kelsey's ability to build trustable relationships has led to several vital alliances and supports for work that requires outreach to historically marginalized communities. Additionally, she stays informed about needs in the department and offers her time and expertise. As the Employee of the Month, Kelsey, your name will be engraved on the Employee of the Month plaque. You have joined us at the Board of Health meeting today, and you are also going to receive 16 hours of administrative leave coordinated with your supervisor. So once again, congratulations and thank you for all of the great work that you've provided for us and for our community.
Thank you so much.
Thank you, Kelsey. Congratulations. Next agenda is any introductions of new employees. Anyone have introductions they want to make? Elise. Go ahead.
Thank you. Thank you. Thank you so much. I'm very happy to announce we have 2 very excellent new employees. The first one is Kirsten Sowerbury. She's the newest addition to our health comms team. She comes from CDPHE. She has an amazing background. She's hit the ground running, and we are just so pleased to have Kirsten with us. And Lauren Thomas is our newest WIC supervisor that we're so glad to have on board. She comes with a lot of experience, and we have 2 great new employees. So thank you so much.
Welcome aboard. Any other? Jim.
Good afternoon, board. Unfortunately, our new employee that started today, I don't think anyone advised her to join us on the board meeting, but I would love to introduce her hopefully next month. But her name is Katie Cashion, and Katie is an environmental health specialist, hired as a new environmental health specialist, comes to us from Colorado Parks and Wildlife with a background in environmental science and worked in the law enforcement end of the Parks and Wildlife Division. We're in 2 weeks, we will also have 2 more new environmental health specialists who I hope to introduce to you, and a new administrative coordinator. So look forward to next month. Thank you.
Jim. Welcome. Any other? All right. Well, how about any staff acknowledgements or achievements that anyone would like to highlight? Elise, go ahead again.
Okay, thank you so much. I am very pleased and excited to share one of the newest accomplishments from Pamela Gould. She auditioned, basically she got an Oscar from CADCA, and I will explain what CADCA is, but she has become a new training and coalition support consultant. It's a very prized possession. There are over 5,000 coalitions who make up CADCA, which stands for the Community Anti-Drug Coalitions of America. And they do their work by providing technical assistance and training and coaching, public policy advocacy, and they are the gold standard. They are the academy. And she was selected from all of her work that she's done with being a CADCA member for over 5 years. So we're just very excited that she will be representing Colorado at Jeffco and making a difference in the lives of coalitions that are working on substance abuse prevention, working with teens, youth engagement, community development. And it's a huge honor. So we are very proud of Pamela for this accomplishment.
Thanks for sharing that, Elise. And yes, Pamela has been an amazing staff person for quite some time now. Jody, go ahead.
Good afternoon. Sorry, I'm going to go back to new employee introductions. I couldn't get unmuted. I wanted to introduce Debbie Bauer, who some of you may know. She comes to us as our new community engagement coordinator. So she'll be working on a lot of the things we've been talking about in our strategic plan and a lot of our other work for many, many years. And she's already just hit the ground running. Again, she comes to us from the Communities That Care, Pamela's team. She's been with us just a few weeks and is already making just fantastic connections with people across the organization, across the county. So definitely wanted to welcome her today.
Welcome. Any other announcements or acknowledgements? All right, well, rolling along. Joe, are you available for our financial report?
Yes, good afternoon, everyone. Bear with me as I get my screen prepared. Hopefully I am indeed sharing the December financial statements. If not, please let me know. Or if I need to adjust the size of the screen, I'll go ahead and increase it just a little bit. Again, good afternoon, everyone, members of the board. Today I will be reviewing the year-end financial statements. In the messaging that hopefully accompanied these statements, it was clear that these are not finalized figures for the 2021 fiscal year. I apologize that the spreadsheet that was probably or more certainly passed along to members of the board did not include this note here. I hope is in red or orange, one of those colors, that clearly states that these are not finalized figures. The reason for that is during the closing of a particular month, there are costs that do trickle in after the fact. It typically occurs that as we close out a month, a vendor, various expenditures are not accounted for and reported to the public health department, to us, until weeks after the fact. When we close out the particular year, it is more important to allow for a little bit more of a time frame to account for all costs that were incurred throughout the year that have not been provided or accounted for at the time of reporting. As we are only at the 18th day of the month, it is typical that year-end costs do take a little bit longer to be reported. Another item that is indeed missing from these figures is the final pay period of the 2021 fiscal year. As our payroll concluded on the last day of the year, it does take payroll some time to release those funds to our staff members, but also to report those figures on our general ledger. So that is in particular one very substantial cost that I know I'm jumping ahead a little bit, that are not accounted for on these financial statements. The payroll, and I'll jump to expenditures first. As we're showing on this statement, we are reporting through this reporting period $15.8 million of salaries and benefits. Please note that we are anticipating almost $600,000 of costs for that particular line item that is currently missing from these reports. So those costs should be coming in here very shortly, but again, missing the deadline to report to the Board of Health. We also are reporting $2.5 million in other services and charges. I'm jumping around a little bit just to focus in on items of concern that hopefully will answer questions that the Board of Health members have at this time. Other services and charges at $2.5 million. Please note that, of course, this has been an extraordinary year from many aspects. From a financial perspective, we've got a lot of additional support to account for our efforts to combat to combat COVID. But with that additional support comes additional costs as well. Many times we see with grant funding, our services or our staff do not have the capability to address all of those needs under that financial award. This is a particular case for this year where we had to extend those services to third parties on several occasions. We've looked at vaccine and testing services. We've looked at interpretation services. But more importantly, a lot of our media campaigns as well were unbudgeted costs that we had to partner with outside agencies. That is one of that is some of the general insight into why those costs are over $1 million over budget. Again, when we create this budget, we are typically 6 months prior to when the fiscal year is about to begin. So it is hard to anticipate a lot of those costs that accompanied our efforts in 2021. So that is one of the main reasons why we're seeing these high costs or over budgeted costs. The other thing to note, although it is very clear that other services and charges are 172% over the budgeted amount that we had for this fiscal year, it's also important to note that we are we're about 6% under budget for our salaries and benefits. So we did reserve or save costs on salaries. And of course, there is some costs still missing from that line item, but you will see that we will be under budget for that particular line item. But some of those costs that would have been reserved for resources on staff, we have extended to third parties to align with the efforts that were necessary for the efforts that were being made during the fiscal year. So bringing us to a grand total at this time of $20.9 million of total expenditures. Again, still missing that final pay period of about $600,000. We are at this point already $229,000 over our total expenditure budget. This, of course, is somewhat concerning as it will indeed require an amendment to this budget as we are only allotted that amount, that ceiling of the $20.7 million. Trying to explain that a little bit further, you can see going back to jumping up to total revenues. You can see that we've brought in $888,000 of additional grant funding over what we had budgeted for the fiscal year. So a lot of those costs that we are seeing in excess of our total budget are a result of additional funding as well. Those indeed do offset each other. Total grant funding is $11 million at this time. Charges for services, we have $2.5 million and investments at $8,500 for total revenues of $13.6 million. Again, this is another line item that we should see some adjustment to, not as significant as total expenditures, but we do anticipate additional revenues that will be accounted for once the final expenditures for the year are indeed settled and we determine which of those costs are allowable under our current awards or the awards that we have approved for the fiscal year. Scrolling down a little bit, looking at our county transfer for the fiscal year, we have $7-8 million of county support through the 2021 fiscal year. As you can see, we've already accounted for $7.3 million, which results in an amount of $524,000 still remaining of the county transfer. When you align all of these categories of transactions, it appears as though we are $750,000 over revenue. We are $229,000 over expenditures, and we only have $523,000 to $524,000 left over in county transfer. However, there are, like I said, additional costs, $600,000 of salaries and benefits, and potentially other costs as well. Where we will account for that variance, what will be the remaining of all of these numbers when they do settle is, as I mentioned, we anticipate there being some more grant funding that will be available. This type of reporting at this point in the fiscal year, January, during the January Board of Health meeting, is in line with where we typically are at this time of the year with our preliminary financial reporting. The major discrepancy or variance from previous years is a lot of these outstanding variables. In previous years, the total revenues have been settled by this point, and expenditures are pretty close to finalizing. Unfortunately, as I mentioned, 2021 fiscal year has been an extraordinary year, and there are still a lot of variables that need to be accounted for. I hope that gives a good insight as to where we are at this point in the financial reporting period, but also noting that we still have a lot more to do as we move forward to close out this fiscal year. I'd be happy to address any questions that the board has at this time.
Thanks, Joe. Any questions for Joe? And I know this is unaudited, but we still would want to approve these, the unofficial numbers for December? So,
yes.
Board, if can I get a motion to approve the unaudited December financials?
I would move we accept the unaudited financials for December.
I'll second.
Any further discussion? All those in favor, say aye.
Aye.
Aye. Sherry, I think you were muted.
Keep forgetting to unmute. Aye, thank you.
Thank you. That's all three of us. All right, approved. Thank you, Joe.
Thank you.
All right, next up, old business. I think Dr. Comstock, you're leading off with a review of the current public health orders.
Yes, thank you, Lane. As you know, there are currently 2 public health orders in place for Jefferson County, JCPH 021-005 and JCPH 021-006. Given updated guidance on isolation and quarantine from the CDC that have subsequently been adopted by CDPHE and JCPH, we vision to JCPH 021-005. Christine Billings has a very short, I believe it's 4-slide PowerPoint that she'd like to walk through with you to explain the revisions that we believe are necessary.
Hello, everyone. I'm back. Christine Billings, head of the Office of Pandemic Response. So as you know, my team is dealing with sort of the impact of the public health orders. So we have some background and requested revisions for Public Health Order 21005. This current piece, we are looking at item number 2. The current state of the requirements in the public health order require that all local government workers, as defined in the public health order, are to submit a negative COVID-19 test result to his or her employer no less frequently than once every 7 days in order to report to work in person. The interpretation of this public health order has been if you test positive for COVID-19, regardless of your vaccination status, you must isolate for 10 full days from either the date of symptom onset or the date of the test if you had no symptoms at all. You can return to work after your isolation period is complete, but you must resume weekly testing. In essence, this means that as long as unvaccinated employees continue to surveillance test weekly and properly isolate and have significant improvement in symptoms, they can return to work as long as they resume weekly testing. And that's shown in the bold text above. The discrepancy is that the public health order strictly says that workers must submit a negative test in order to report to work. So we have a conflict in the language as written in the public health order. In essence, we are requiring a negative test. Sorry about the dog. The run didn't work apparently. Requiring a negative test prior to return versus the guidance for the general population is not to retest to return to work. CDC's current guidance is that most people do not need to test within 90 days of a confirmed infection as diagnosed by a viral test. Viral test is that PCR or antigen-based test. So that's the current state. We have conflict between the language. The impacts are that many of the roles that are seeing the downstream effects of this ongoing testing, negative test issue are critical infrastructure employees with critical government functions that can only be conducted in person. There is a large amount of staff time that is being spent addressing the questions about this discrepancy, thus taking away from time that we could help these facilities mitigate the transmission of COVID-19 within their facilities. And the interpretation of the current public health order language is a contentious issue impacting the JCPH infectious disease epi team as they work to provide useful assistance to our community partners. So that is the revisions to consider based upon the case that was presented. We'd like to revise Public Health Order 21005 to include that all unvaccinated local government workers, as defined in the public health order, must resume surveillance testing upon return to work every 7 days. So that is as written. So resume testing, you go back to work, you resume your testing. If a local government worker continues to test positive on their surveillance tests within 90 days from the date of that original positive COVID-19 test, as long as they are symptom-free, they may continue to work in person. If a local government worker tests positive after that 90 days from the original positive COVID-19 test, they must re-isolate and be treated as a new infection. If local government workers become symptomatic during their 90 days of presumed immunity, they should stay home and test for COVID-19. So we are still keeping symptomatic people out of our local government workers who are symptomatic out of those public spaces. We are still requiring the isolation if they test positive, but we are not requiring that negative test in order to return back to work, because we know that that's not always the case, and it aligns with the CDC guidance and the guidance that we are giving the general public. So that is item 2 within the public health order. The next is relates to item 4. The current state requires all local government workers to isolate for 10 days if the person tests positive for COVID-19. CDC, as we are aware, at the beginning of January of 2022, has revised their quarantine and isolation guidance to a required isolation of 5 days if a person tests positive for COVID-19. The revision to consider is that 21005 reflect current JCPH, CDPHE, and CDC guidance, which is the required 5-day isolation period. So those are the 2 pieces that we'd like to see up for discussion and revision of 21005. Dr. Comstock?
If there are any questions for Christine, please, Board of Health members, ask her at this time. And then Kelsey did go ahead and take the liberty of doing a red line draft, incorporating these recommended revisions for your review, if you would like to see that red line draft. First, are there any questions for Christine about why JCPH is requesting the board consider these revisions?
Christine, I have a question for you. So for the employees that return to work, there's no testing, or I guess even if they test positive in 90 days, as long as they're symptom free, they can still work. Is there a reason we want them to test for those 90 days versus waiting for 90 days to then resume testing? And then obviously if they're symptomatic, they would still need to be excluded. But since we're not using a positive test to make a decision, is there a reason you still want them to test for those 90 days?
Yeah, the ongoing testing requirement is to catch any variants that may come up. We know that there is, we presume that there is immunity, and the CDC has stated that in their guidance documents, that it's presumed immunity for 90 days. If someone becomes symptomatic and tests positive, we want to make sure that they are being isolated outside of the workplace. So that ongoing testing requirement is to catch any potential variants among our unvaccinated population and prevent spread of those potential variants. In addition, we may have, get close to that 90-day time frame, see someone test positive. That's a conversation that our infectious disease EPIs can have with the facility to decide what to do with that as far as quarantine for other exposed individuals.
Board, any additional questions for Christine? All right, seeing none. Is there a motion to adopt these changes to public health order?
So moved.
We have a motion.
I will second it.
All right, any additional discussion? All those in favor of adopting these changes, please say aye.
Aye.
Aye. All right, motion carries. So we will make those changes. Thank you, Kelsey, for already drafting those.
All right, thank you on behalf of my team to the board. It's greatly appreciated.
You're welcome. And does that address all the changes, or were there additional for order 21-006?
Yeah, Lindsay, can you take that PowerPoint down now, please? So at this point, there are no recommended revisions to JCPHO 21-006. It's my understanding that the Board of Health would like to review and discuss that each month at your Board of Health meetings. Given the Omicron surge where we're at right now, the fact that we hope we have now hit our peak, but it will be several weeks before we come down from that very high peak. The recommendation to the Board of Health is to maintain JCPH 21-006 for one more month and to revisit it again at your next Board of Health meeting next month. And that is consistent with the current plans for the other Metro Denver area public health departments as well, and they're currently in place PHOs.
Thank you. Sherry, go ahead.
Thank you. I just had a couple of them, and I think the one is, very simple. Our businesses that are doing the vaccine passports, and they have chosen to do that, and they go through and they get all certified. Right now, they're being put up on the website, and quite honestly, some people are not being very nice to them, and they are getting phone calls. They're getting some people showing up at their business and some very unkind things and harassing them. And so my ask, and it would be just, even if it wasn't the case that they were being harassed, if a business wants to be put on the website, that they should be able to ask to be on the website or to approve that, not just automatically be put on the website out there for the public. And I would say that in any case. So I would like the board to consider saying that if someone is vaccine passport authorized, that they then give permission to be on the website instead of just automatically being put on the website.
And so that's kind of, I think, administrative. Is that correct, Sherry? Because I don't think the order requires any of that. So.
Yeah, I mean, I think it is administrative, but I would like the board's opinion and see if we can't get that done.
All right, any thoughts on that?
Well, I'm pondering it because, I think community members want to know, the community members that are concerned about their exposure, want to know about businesses. So, I mean, I just think it's terrible that the businesses that have done this are being subjected to any kind of harassment. But I guess it makes sense to give them that choice. And if they have plenty of business without those folks who are very concerned and are only going to businesses that they find on the website, why, that would be their choice. So I'm okay with it, but I do think it's kind of got two sides.
Well, and I appreciate that, Harriet. One of the things I'll say is that people have brought that exact issue up and have said they get many phone calls saying, are you vaccine passport? Because those are the only ones that want to go. And so people are calling businesses to very specifically ask if they are qualified as vaccine passport businesses.
Yeah, you're right that the website's not the only way for them to find out about it. So.
Correct.
If I may, I can walk through the Board of Health. As you know, the Board of Health sets policy, and then it's responsibility of JCPH to implement and manage that policy once approved by the Board of Health. I can walk you through the thought process. There was a very thorough examination of this issue, discussion of it, and I can walk you through the decision-making process of why JCPH did go toward putting everybody on the website, if the Board of Health would be interested in that. I have had a couple of questions from Board of Health members offline, and I have gone through that with them. But if it would please the board, I'd be more than happy to go through that in this public forum if you would like me to.
Mary, would that be helpful? Have you already heard that, or?
Sorry, were you asking me?
Yeah.
Yeah. Dr. Comstock did go through all of that with me.
And you still feel it would be appropriate to let the businesses choose?
You know what? I do feel really strongly about that because, I mean, if I'm going to be on a website, I feel that I should give permission to do that. As an individual, I would never want somebody to just say, oh, put it on the website, she's vaccinated, or, in my business. I just feel that that is a very personal choice, and I don't think it's a lot of our businesses to ask, as they're all trying to comply with all of the, stuff that we have put into the order. I think it's a pretty simple ask, and it makes sense to me.
If the board pleases, I would like to explain why the businesses are listed on the website. And just so the board knows that I have had this discussion with Board of Health member Ms. John, and she has relayed to me personally that she has received some complaints. I did check with our team that is administering this project in JCPH. They have received 0 complaints from businesses to date. 0 requests to have their names removed from the website to date, and 0 questions about whether or not a business had to be on the website during the process of application or during any interaction with the businesses. So the only way that this concern came to our attention was through Board of Health member Sherry John. There are several reasons why we currently have businesses listed on the website. The first reason is this is a public health concern. And as Dr. Hall said, for those members of Jefferson County community that would like to be as safe as possible while frequenting Jefferson County businesses, they can go to our website and see the list of Jefferson County businesses that have been approved as fully vaccinated facilities. So it is a way for our community members to know which businesses they can feel more comfortable frequenting if they are in fact looking for safer alternatives. That is one reason. A second reason is that even if we added an opt-out option for businesses, we cannot protect their names. That is CORA-able information, and we have already received CORA requests. before our website was actually up and running, we did receive core requests for the names and contact information for all of the businesses that were applying to be fully vaccinated facilities. So there was a concern, Kelsey and I did have a conversation. There was a concern that if a business asked us not to put their name on the website, we can't protect that business. The business's name will still go out, and there can be a misperception by a business that requests they not be on the website that we will somehow protect their information, and we simply can't do it. Anybody that requests it via Cora, we must release that information to them. A third reason is that this Board of Health and the Board of County Commissioners have been very adamant that we try to have a regional approach across the Denver metro area to provide a level playing field for businesses across the metro area. The other counties have listed their fully vaccinated facilities on their websites. So whether you think having your name on the website is a positive or a negative, whichever way you think it is, if Jefferson County offers an opt-out option or does not, or offers an opt-in only option, we will no longer be consistent with our neighboring metro counties. And then there's a question of fair playing field for businesses across county lines. So there was a lot that went into this. You know, at the end of the day, again, the Board of Health sets policy, and then it's left to JCPH to implement and manage that policy for the Board of Health. If there is such a change, I would respectfully state that it needs to be the Board of Health going back and revising your PHO. Honestly, this just doesn't seem to be the appropriate way to approach it, given the lack of complaints that we have received to date, and the very strong concern I have that there may be a misperception among some businesses that by not having their name on the website, they will be protected from those who wish to harass them, when that is not true. Their information will be Cora'd, and it will be released on social media anyway. And those same people that are harassing them now will very likely still be harassing them. It will just be the community members that wish to frequent and patronize those facilities that will no longer be able to identify them.
Sure, go ahead.
Yeah, so is there a way then that when they are going through the process of becoming a vaccine passport business and going through all the training and stuff that they do, is there a way then at that time for them to be given the opportunity to know that it's going to go up onto the website where they can say, I would rather opt out, please? Can they just be made aware of it? Because I know I have had calls, and I know there was one in Golden that did request that their name be removed, but I just think that they don't even know that it's going to go up there, and then all of a sudden they're getting these phone calls and these harassments and stuff. They at least should be able to know and to be given the option if they then want to opt out.
Yeah, clearly I can instruct staff to, we can revise the information on the form that the businesses have to fill out. We can definitely provide more information to make sure that businesses are aware. It is on the website already. There's a link for the fully vaccinated facilities. It's on the same page where businesses go to apply to become a fully vaccinated facility, but we can clearly address that concern that businesses aren't aware. We can update that web page to make it more clear to businesses that are considering applying that that a list of fully vaccinated facilities is presented on the website. I will contend that I wish that there was something we could do to protect these businesses from harassers, rather than trying to just say that we'll keep them off the website, because that's not going to protect them. Their name will be Cora'd, and they will be that Cora will be posted to social media, and they will still get harassed. I wish there was some way we could work with our local leaders, our local law enforcement, et cetera, to stop the harassment. I think it's an incredibly, incredibly sorry state that we have community members here in Jefferson County that are harassing businesses that are just, you know, trying to go through a process so that their own employees and their own patrons have a slightly safer space to work and do business, and that they do not have to wear masks in those spaces.
Something that you said just triggered a thought, and I have a question. So if they do request to be taken off of the website, do we comply with that? Do we honor that?
We have not had a single request for that yet. And not a single business has contacted Jefferson County Public Health to complain. Not a single business has contacted Jefferson County Public Health to request that. Again, my conversations with Kelsey is that if we took their name off the website, we will still have to release it via Cora. So it is offering them zero protection to remove them from the website. It simply then disadvantages those members of our community that are looking for fully vaccinated facilities to be able to make a personal decision about shopping in a place where they feel safer, or patronizing a business where they feel safer.
But it does seem we don't want to create disincentives. So I guess in the event that you do get a request there, I would ask you to consider that. I don't think it makes us, I don't think it significantly alters our program compared to the metro areas, but I would hate for a business to say, then I don't want to be part of the program if you won't take me off the website. That to me is not a win for our community. So, and at least people have to jump through more hoops if they're going to take those kind of inappropriate actions, in my mind. Sherry, do you have any specific changes you want made, or is this something that you can continue to think about and bring back to our next meeting if you have specific edits to the order?
Well, my specific ask would be that they be given the option of opting in. The least we can do is to, when we take them through the process of their, application to become a vaccine passport business, that they at least be made aware and be given the opportunity to not have their name put on a website. I understand the whole Cora thing. Coras are a perfect pain. I get that, because we have to go through and dig up a lot of information. It does take a lot of time. I get that. I just think that if we think about it, a person shouldn't have to be on a website if they don't want to be on a website. To me, that's just a very personal choice, that they should at least be given the opportunity to know, and then to say, yeah, please don't put me on there.
And again, Sherry, this is not out of line with the way that Jefferson County Public Health processes many of the items that come to us. Restaurant inspections are available on our website. Lists of individuals that have requested well permits is available by request through Jefferson County Public Health. Members of the public that do business with Jefferson County Public Health, that is public business, and it is available to the public upon request when it's not already posted on our website. Again, please, I want to make sure the board understands that the core issue is, it is a staff time burden, but that is the very lowest thing on the list of all the determinations we made. The core concern was that if a business asks to not have their name on the website, there is some presumption of security that we cannot fulfill. Because we have already received core requests. We will continue. We have received over 100 core requests, and we have submitted nearly 4,000 pages of documents in response to those core requests. And we did receive a core request specifically for the names of businesses. I'm concerned that if a business says, take me off the website, I don't want anybody to know I'm a fully vaccinated facility, that is not providing them the protection that is implied by us responding to that request, because their name will be recorded, it will be put on social media, it will be shared with those who intend to do them harm, and it will not solve the problem of preventing harassment. I wish there was a way. I think it's incredibly sad that we cannot prevent this harassment, but not having their name on our website is not going to prevent it.
And so I appreciate that. I think you can share that exact information if someone were to make that request. So again, it doesn't seem unreasonable for that dialogue to happen if they still agree and don't want it. But again, I don't want to belabor this any longer than we need to, but Sherry, if you have specific edits to the order, please feel free to bring those forward. But yeah, it does seem reasonable to me that if they make that request, you can explain what you just explained, that if there's a request for that information, it would still be released. I just don't think we need to disincentivize if there really are people that come forward. So go ahead, Sherry.
Thank you, Lane. And then I had one more ask that I have been speaking with a lot of the gyms in the area, the gym and fitness centers. You know, when all of the pandemic started and the state did their big program, there was the big 5-star program. And I know that during that time, a lot of the gyms and the workout facilities went to a great expense, and some even before that, of really upgrading and doing a massive amount of work to their ventilation systems and to all of that. One of the asks that I've had, and it makes sense again to me, is that while they're exercising at the station where they are, that they be able to take off that mask. But when they get up, just like they do in restaurants, you get up and you take your mask off, you get up to go use the restroom, you have to put your mask back on. So during all of the moving around, they have to have a mask on. But while they're actually doing the exercise, that they be able to take it off. And that's, you know, it's the same as what we do with restaurants, basically. And so I wanted the board also to consider that. You know, we have a lot of people that are, because it's strenuous when you're trying to work out, you know, you're wearing a mask. It's very strenuous to try and do that. So they're just not going in. Their businesses have dropped in half and they're really struggling. And now they put all this money into ventilation system, because that was supposed to be, you know, a good thing to do through the 5-star program. And now their business is at half because people just aren't coming in. So I would ask that while they're stationary, they be able to take the mask off, and while they're moving around, they can put it back on.
I think the risk there is without social distancing, when you are working out, you're breathing harder, you're projecting, you know, droplets further. So without social distancing, it does feel like an increased risk. Again, I appreciate it. I think they have done a lot of work. So to me, without some additional mitigation, you know, it doesn't feel appropriate that, you know, while you're exercising, you can be unmasked and still be surrounded by other people. So to me, without social distancing, I don't know that that's a good thing for us to do, especially where we're at with the current surge.
And when you say
I will
social,
also remind the Board of Health that that option does exist. If a fitness center would like their patrons to be able to work out unmasked, they can apply to be a fully vaccinated facility. Over 20% of the Jefferson County businesses that have been approved as fully vaccinated facilities are gyms, fitness facilities. There also is wide latitude under the Board of Health order. They could request to be a fully vaccinated facility only for certain rooms within their gym, or only for certain days a week, or only for certain hours of the day. There is a lot of flexibility. Again, over 85% of adults in Jefferson County are vaccinated at this point. So if a gym's membership is reflective of the county, then over 85% of their patrons should be fully vaccinated. So if they request to be a fully vaccinated facility, at most their business should only decrease from 100% to 85%. And that would allow those individuals who want to work out without a mask to do so. We have not been provided, I appreciate that there's anecdotal evidence. We have not been provided any hard data to indicate that the mask mandate has decreased gyms patronage by 50%.
That actually brings up a good point. Actually, 2 of them that contacted me are vaccine passport gyms. They have already done that, and their businesses did drop. But that does bring up a really good point, and that is, I know that I saw a report that came out of Denver, and they listed the top 10 industries where they were having the highest outbreaks, et cetera, the most issues. And gyms weren't even in the top 10. So just interesting. It might be kind of an interesting thing to find out, where do they fall in that category? Are they, one of the problems? Because the ones that contacted me were vaccine passport businesses.
Is there a specific motion that you're making, or just wanted to bring that up as discussion?
Well, no, again, I would like to see, the public health order reflect, like when you go to a bar and restaurant, it's not like people are spaced anymore. They're not spaced 10 feet apart or 12 feet apart or whatever. And they're given the opportunity to, take the mask off while they're sitting at the bar or while they're sitting at their table. And again, when they get up, they have to put a mask back on. So I would like for the board to consider making a change in that. I'm trying to keep all these businesses as much in business as we can. They're facing great hardships, and the equipment that they bought, and especially the ventilation systems, were in the thousands of dollars because they wanted to comply, with the 5-star program.
So
I will point out at this point that we have some businesses who have been absolutely amazing, and some in the fitness industry are the leaders in doing just really amazing things to protect their staff and protect their patrons. Unfortunately, fitness centers are also the business sector where we're receiving the second highest complaints from members of our community about them not requiring masks inside. There's one chain in Denver, in Lakewood, where we keep receiving complaints, change that their front desk people continuously tell people that it's up to them if they want to wear a mask or not. There's no requirement, there's no order, the public health department can't make you. So while there are a lot of really, really wonderful fitness facilities out there that have worked incredibly hard to protect their patrons and their employees, there are others that actually are receiving a lot of complaints. And I will recommend against any such motion to revise the PHO to exempt fitness facilities, because exercising, as Lane said, is an incredibly high risk activity, because you are breathing so deeply and so forcefully when you exercise. Without the proper distancing and ventilation and it is just an incredibly high risk activity. So I recommend against this.
Well, I think that to me is a piece, maybe it's a compromise, is looking at what it would take. So again, I agree. I don't know that every facility has done and made those investments in those efforts, but the ones that have, it does make sense to look at opportunities. Again, similar to the vaccine passport, maybe there's, again, back to what the 5-star was. If they're mitigating the risk through other ways, again, through improvements in their ventilation system as well as social distancing, it does seem for us to at least consider those things. But yeah, I don't want to just make carte blanche. Anytime you're working out, you can take off your mask. It does feel like there's a lot of nuances that also need to be in place. And again, I don't know that every facility has done that. Harriet, go ahead. You had.
So my question for Dr. Comstock is whether any of the other counties that we're trying to work with have made any changes to their regulations about this, any mitigation standards that we could look at for, for a role model, or are they all, kind of exactly the same as we are?
Yeah, thank you for asking that, Dr. Hall. the fitness industry has reached out to all of the LPHA directors across the metro area, as well as the governor, requesting exemptions for fitness centers. At this point, there are no exemptions for gyms and fitness centers in any of the PHOs in the Denver metro area. So again, if Jefferson County made this move, at a very minimum, if you are considering this move, I would request time to go and speak to the other LPHA directors, because again, it would provide an incredibly unfair playing field across county borders for businesses, something that we have been instructed to try to avoid previously. But in addition to that, I would like to, if the Board of Health is requesting us to do so, it will take a while for JCPH staff to try to do all the research needed to determine what would be a potential new version of some kind of a 5-star program. What would they have to, what standards would they have to meet, and how could we possibly implement and manage that kind of a program? Do we even have capacity to do it at JCPH currently? There are a lot of questions that have to be answered. But definitely, I would request the opportunity to have a discussion with the directors of the other counties, because to answer your question at this point, no. At this point, every PHO across the Denver metro area is a universal mask mandate that does not have an exemption for fitness centers unless those fitness centers have achieved fully vaccinated facility status or the equivalent in whatever county they are doing business in.
Jeremy, go ahead.
You know, the one thing that I would say is that would be a great idea. And that as we're bringing those people together, I would also ask that we bring all the stakeholders, not all, but stakeholders to the table so that we can have a dialogue, so that we're meeting with the industry folks and listening to what is it that they want, what is it they're willing to do, and how can we collaborate, and are there any compromises? You know, the data that we find, you know, what the other counties are doing, that's fine. But I would ask then, and I would be happy to be a part of that, to bringing people to the table, including the actual stakeholders, so that we have a good dialogue and get the full picture and what the ask is.
Yeah, Ms. John, again, so I did meet with representatives of the fitness industry. We had a very good, robust discussion. And part of that discussion is I did challenge them. I asked them to get together as an industry and to come to us and tell us what they thought the standards needed to be. And I did request that they reach out. I gave them some specific guidance about what kind of indoor air quality experts they should reach out to. And I did ask them to come back to me with a recommendation of fitness centers that met these criteria should be allowed to go maskless. I did tell them that whatever they brought to me, I would take to indoor air quality experts, and they never brought any proposal to me. So I did have a meeting with them. I did listen to them. Okay. I did make an offer to them, and they never responded with the proposal that I had asked of them.
I appreciate that. This will be a good chance for them to get to the table if they want a voice in this thing. So I'll be happy to work with.
Offline, if you'd like, I'll be more than happy to share the names of the specific individuals that I met with in the
Okay, that's fine. Thank you.
All right. Well, I'll move us to our next order of old business, on-site wastewater treatment system proposal review. I think, Jim, you're going to lead that.
Yes. And I'm going to have Mitch Brown and Roy Laws join me. And I will give you some introductory comments. And then Roy is going to support this effort with a display of some of the data and other evidence that would support the proposal that's before you. And then Mitch will head up or lead the discussion of the actual policy document and any discussion that comes along with that. The first point that I want to make on this is that this is a Board of Health policy meeting to talk about on-site wastewater treatment system standards for the Indian Hills and Parmley Gulch area. I know there's been earlier discussions in previous meetings about changes overall to the overall county regulations. This evening's discussion has nothing to do with the overall changes to the county on-site wastewater treatment system regulations. This is strictly talking about standards for Indian Hills and the Parmley Gulch area. At the May Board of Health meeting, I gave the Board of Health a historical overview of the Board of Health resolutions and accompanying policy associated with the permitting and installation of on-site wastewater treatment systems in the Parmley Gulch watershed. In June, we updated the board about some outreach and other activities that we had been involved with at that point in time in the Indian Hills community. And additionally, staff shared that JCPH has been approached by some individuals in the Indian Hills onsite wastewater treatment system prohibition area that was established back in 1979. These individuals expressed interest in developing their vacant property within the prohibition area. During the June meeting, staff questioned whether it was prudent or even advisable for the board to grant variances or exceptions to the resolution or policy, even when the requests may make good sense or appear to be sound scientifically based requests. At that point in time, council suggested during the meeting that if the board wanted to allow development in the prohibition area, it was better for the board to revise its resolution and policy accordingly. And the staff committed to bring you a draft of a revised resolution and policy document for issuing permits and installation of OWTS or on-site wastewater treatment systems in the Parmley Gulch watershed to discuss at your July meeting. The original 1979 Board of Health resolution established that the installation of on-site wastewater treatment systems on the lots that were designated as the prohibition area would constitute a hazard to public health, and they prohibited the issuance of individual sewage disposal system permits for those parcels. That's back in 1979. The 1979 Board of Health resolution also stated that in order to minimize the impact of further development on the contaminated areas of Indian Hills, namely the prohibition area, due to adverse geologic and topographic conditions and the existing high potential for contamination, the existing lot size, and we're talking in areas outside of the prohibition area, the existing lot size requirements for areas upslope of the prohibition area be increased, and that individual sewage disposal system permits in those areas be restricted to systems that will potentially not release nitrates into the environment. Two very important points from the original resolution. In the upslope areas, the Board of Health in 1979 suggested that lots be larger and that systems being installed not potentially not release nitrates into the environment. I'm being very careful to read this because the language comes right out of the original resolution. And an additional requirement that they had made in the 1979 resolution was that permit applications for individual sewage disposal systems in those areas be presented to the board for review. So the board was reviewing every single application that came in for that community. The Board of Health in that resolution did not define the size of larger lots, but at the time, 1 acre was the size lot required for well and on-site wastewater treatment system for lots created before 1973. The term not potentially release nitrates was also not defined, but certainly sealed vaults, segregated systems, crude incinerator toilets, they were all available options, albeit not very practical for full-time residences. But as time has gone on, on-site wastewater treatment system science has progressed. It's amazing in 40 years of doing this, how quickly or how much the science of on-site wastewater treatment systems has progressed. And slowly, technological improvements were advanced, resulting in systems that can remove upwards of 70% or more of the nitrogen from on-site wastewater treatment system effluent from these systems. In fact, just earlier last fall, I discovered that a new system has been certified in the state of Colorado as a TL3N system that claims an 80 to 90% reduction in nitrates prior to discharge. We believe that the advancement of science, technology, and with the evidence gained from our work in the Parmley Gulch watershed over the years has made this a time that is ripe to look at appropriate and limited development in the Prohibition area, with accompanying limitations on the development, redevelopment, and repair of aging systems in what is termed upslope and hybrid properties outside of the Prohibition area. We also believe that it is necessary to establish a mechanism to collect more and current data relative to the state of nitrate contamination in Parmley Gulch groundwater. The draft documents you were provided in your packets represent our attempt to create a balanced approach between public health and water quality protection, while allowing property owners a prudent, reasonable, and equitable way to utilize their property rights and maintain their property values. The draft resolution carries forward the concerns in the basin related to nitrates in the groundwater system and adopts the accompanying revised Board of Health policy for issuance of OWTS permits in the Parmley Gulch Basin. So some of the key changes or updates to the Board of Health policy from the 2014 policy include the allowance of new development and redevelopment in the Prohibition area with strict limitations to prevent increase of nitrogen mass loading in the Prohibition area based on a mathematical carrying capacity model developed by JCPH Environmental Health Services, and a requirement for a net nitrogen mass loading reduction in the Prohibition area. Also, another change includes limiting development on lots less than 1 acre to only developments in the upslope hybrid areas that can demonstrate a net nitrate mass loading reduction. So smaller lots may be allowed, but they have to demonstrate that they're actually producing a net reduction in mass loading of nitrogen. Another change would establish minimum nitrogen reduction systems or a higher level treatment system requirements based on lot size in the upslope areas and on hybrid parcels. So outside of the Prohibition area, the standard would be a minimum treatment level based on the size of the lot. Another change establishes requirements for upgrading existing on-site wastewater treatment systems that do not provide nitrogen reduction treatment. I also mentioned earlier, there's a requirement in this policy for water sampling in conjunction with on-site wastewater treatment system permitting for properties on private water wells. That would be, and we'll get into this a little later, but that would be for construction, repair, and for use permits or transfer of title permits. And then finally, the proposal requires a JCPH review of all building permit applications in the Parmley Gulch watershed for construction of new or remodeling of existing living spaces. We're not talking about sheds or fences or building permits for things that do not involve living areas. It would be strictly for adding on to homes and perhaps modifying spaces within homes. So this is very similar to the proposal that was presented to you in September or July and through September. Staff received 32 comments from around 20 people during the public comment period. The predominant number of comments related to a desire by the commenters to extend the use of the mathematical model across the watershed. JCPH staff believe that it's inappropriate. It is appropriate to utilize the mathematical lot sizing model in the prohibition area at this time because this approach would work to reduce the overall nitrate mass loading to the areas deemed by the Board of Health in 1979. Those lots, those parcels that they felt were a high risk of becoming a health hazard if further development occurred in those areas. Higher level treatment and or source separation types of on-site wastewater treatment system have been required in the upslope and hybrid areas since 1979. So as I've said before to you, we have been applying a science-based approach to reducing nitrate mass loading in the Parmley Gulch watershed because science is what has developed the higher level treatment systems that are currently and have been used in the upslope and hybrid areas for the last 40 years. I believe there is insufficient evidence at this time to suggest that there has been further degradation of groundwater resources in the upslope areas of the watershed. There are definitely, and I will say, there are definitely examples of well water samples that have exceeded the 10 milligrams per liter safe drinking water standards for public water systems. But when you look at the data, the number of these wells is very small compared to those that have shown water quality less than 10 milligrams per liter of nitrate, and many even less than 5 milligrams per liter of nitrate in the water. And Roy will share a little bit of that data with you in a few minutes. Staff believes that limiting the number of bedrooms one can have in their house as required by the model is fraught with potential issues ranging from those who may cheat on bedroom declarations to loss of property value. There is evidence out there that suggests that average household sizes in Jefferson County are somewhere between 3 and 4 people per household, which is approximately 40% less sewage flow than what a standard 3-bedroom house is designed to handle. So what I'm saying here is that, although the houses and the septic systems are not designed to handle the load from 6 people in a 3-bedroom house, typically there's only 3 to 4 people based on data from this county. It makes more sense to establish the highest level of treatment as the minimum standard for smaller lots. The vast majority of homes being built in on-site wastewater treatment areas of Jefferson County are 4 bedrooms or less. We don't have the data at our fingertips, but I would venture to say that the vast majority of homes on the lots that are served by septic systems or on-site wastewater are 4 bedrooms or less. It's not to say that some people build 5, 6, 7, 10 bedroom homes, but typically those larger homes or larger bedroom counts are found on larger properties and are not your typical type of housing that we find or that's being built in Jefferson County. Staff believes that a minimum lot size of 1 acre when connected to the Indian Hills Water District supply is warranted. We heard this comment several times from folks that, why are you allowing half-acre lots to be built on, 3, 4 bedroom homes to be built on half-acre lots? And, considering that, they're right, at least in this community, where we've been requiring minimum 1 acre for well and septic, all of the homes are discharging their wastewater through on-site wastewater treatment systems into the same water supply. So it doesn't make sense to us to allow for, a half acre to be developed. So we're asking for or suggesting to the board that minimum lot size of 1 acre should be required for all homes in the upslope areas, excuse me, and in addition to the ones that are going to be connected to the Indian Hills Water District supply. Staff believes that the change to requiring minimum higher treatment levels based on lot sizes for both new construction and repair or replacement of existing on-site wastewater treatment systems in the upslope or hybrid areas will gradually improve water quality in the basin. Over time, more and more systems, if we follow this policy, more of the old systems, the aging infrastructure that we have in that community will be replaced with high level treatment, and anything at least according to the way it's written right now, anything under 2 acres would be required to have a TL3N treatment in order to provide the highest level of treatment and remove the most mass of nitrogen from the watershed. Although current build-out analysis or analysis of build-out has yet to be completed, staff believes that the 2020 planning and zoning analysis suggests that there are relatively few parcels over an acre available to be developed in the Prohibition area and within the Indian Hills Water District boundaries. Roy will share a little bit of information about that in a few minutes. Staff recommends that this Indian Hills policy require a 1 acre minimum, again, for lots with either public water or private wells. In addition, staff recommends that all minimum setbacks be able to be met in order to receive a permit. Several counties I've been in contact with have large minimum lot size requirements for new subdivisions, but they honor existing lot sizes of old platted subdivisions if the owners can demonstrate that they meet the regulatory setback requirements or utilize higher level treatment. The proposal before the board today will require both of these requirements to be met in the Parmley Gulch watershed. Not only will they have to meet setbacks, but they will also have a minimum level of treatment that must be met. Finally, by establishing minimum treatment levels for smaller lots, along with implementing the strong standards of overall on-site wastewater treatment design in Jefferson County and Colorado, staff believes that JCPH is addressing the stated purpose of the on-site wastewater treatment system regulations to protect public health and water quality, with the gradual impact of reducing nitrate mass loading over time as older systems are upgraded to higher level treatment. With that, I will hand this over to Roy to provide an overview of some of the evidence that we reviewed in order to make this proposal to you. I believe Roy is still on.
Yeah, I think I unmuted myself, and I just need to make sure that I can pull up the PowerPoint presentation. Mitch, I don't know if you were planning to run the PowerPoint or if I should load it up myself. Guess I'll wait to hear from Mitch because I did see that it was opened a little while ago. So if I'll just go ahead and try to share my screen once I find that button. Stage fright? How come I saw it earlier and now I don't see it? I'm not shy of being on the stage, folks. Don't worry about that. I just got to find the right button to push. I'm not seeing it. So, oh, here we go. Share screen. It's big and green. I don't know what I was struggling with so much. So let's make sure I get on the right screen. I'm not positive which that one is. Oh, I'm going to try one and see what happens here. Let's share that one and see where we go. Hey, not bad for throwing a dart.
There you
go. Okay, and then we're going to pull up this presentation. Jim, I want to thank you for that, very good introduction. It's just loading up and great overview because you really did a good job of summarizing the history and, the point that we're at and the path forward as far as our concern with nitrogen pollution in the groundwater system. So thanks for that intro. Let's see if this does it. And I guess I got to go slideshow from beginning.
I think you need to exit your Explorer, whatever this is, because we're seeing your list of files here, Roy.
Well, I see a nice big screen. So with the PowerPoint. So I don't know what I'd need to push.
Close this file or the list of files.
Yeah, I don't have, right now, I don't even see that as an option. So what I see is the PowerPoint.
Do you want me to share my screen, Roy? That'd be
Please,
helpful.
let's do that.
Okay, give me 1 sec.
Thank you, Lindsay. And do you need directions on where to find the file?
I sent it to her.
Thank you.
There you go.
All right, great. So Lindsay's going to drive. In summary, I really think it's good to have this basis and purpose of this policy in mind. I can't actually read the whole thing because I have pictures of people over here on the side. I wonder how I close that down. Let me see if this will do it. Yeah. There we go. It was the data that we had gotten from wells, both private citizens and the Indian Hills Drinking Water or Indian Hills Water District that alerted us to this problem, gosh, in the late 60s. So we've known that we've had nitrogen degradation, nitrogen from septic system degradation of the drinking water supply for, gosh, more than 40 years now. The other piece of that is that, well, what's going wrong? Because we're applying the minimum standards that are set forth in the on-site wastewater treatment regulations. And we realized because of the conditions, the geologic conditions there, the development densities, that those minimum standards alone are not adequate to protect human health and water quality. So that's where we say, well, how do we augment these minimum standards? And we do this through policies that we can develop for areas that warrant it. And certainly the Indian Hills Parmley Gulch does. So that's the basis. And so then we say with this policy, what are our goals and objectives? Well, we certainly want to reduce the mass of nitrogen being discharged from septic systems into the drinking water supply. That would certainly improve the problem if we can reduce that mass load over time, and then also to protect it from further degradation. So I think those are the things to keep in mind as we continue to move forward. Next slide. So what did the data say? Well, this is pretty much right out of the 1979 resolution. It provided these values to us, and there's 140 samples collected and analyzed, and they looked at the nitrate data. And so the chart on the right says what some of their high values were as far as nitrate in drinking water, in the water. Public water system high value is 15 milligrams per liter. Keeping in mind that the safe drinking water standard is 10 milligrams per liter. Now, just a reminder that the public water system does have nitrogen treatment systems in place, so they certainly reduce that level to below the safe drinking water standard for the water that's distributed through the system. But this is just one of their wells that was higher than the drinking water standard. Private wells up to 40 milligrams per liter. So that's almost 10 times the safe drinking water level. They provided some low values in the resolution, but I know there were values that were certainly lower than the 4.6 and 2.6. There were some as low as 0.1 milligrams per liter, which is anything below 1 milligram per liter is what we would consider probably background concentrations of nitrate. So they further evaluated and broke it down into these the table on the right, which shows us nitrate in milligrams per liter in the Leftmost column in the center tells us the number of wells that had nitrate values in that range. And then on the rightmost column of the right table, out of the 75 wells, what percentage of these wells were within that range? And as Jim pointed out, the number of wells that exceeded the safe drinking water standard, about 15%. However, as I had mentioned, anything above 1 milligram per liter probably indicates some degradation of the background water quality. So again, background water quality, we're looking at 1, maybe 2 milligrams per liter of nitrogen. Anything above that level is probably had some degradation in quality. Next slide. So now we're going to take a look at more recent data that we have. And this is broken down into different sampling events. You can see that on the right table. Then you can see the number of samples that were collected during each event, what the sample mean was. That's the average value for that. So when you see from 1975 to 1981, there was 123 samples collected. The average value was 7.8 milligrams per liter, and the sample median, and that means 50% of the values, 50% of the 123 samples were above 5.8 and 50% were below 5.8. So that's what the sample median is. So again, we can look through the other years through time. 1996, the sampling event. Also, there was an event 1991, 2001, 2002, 2004, and then 2018 through 2021, the more recent set, we've got 16 samples there. Sample mean, 7.39 for that most recent round of sampling, with a sample median of 6.9. When we take a look over the text box on the right side, we see that the average nitrate concentration of the 123 samples from 75 to 81 is 7.08 milligrams per liter. When we take a look at the average concentration of all the samples collected since 1981, we've got 132 samples, pretty good sample set, and we come up with an average of 7.15. So while it's a little bit higher, I don't know that we would consider that statistically significant. So overall, but you also have to keep in mind how many new houses have been added to the basin over that period of time since 1981. And there's been certainly new houses developed. So I think in looking at this data, you might say that the policies in the 1979 resolution did what was intended to do, in that it kept the problem from becoming worse. Even though there was new development added, we're still at about the same level on average. Next slide, please. I think it's important to have a conceptual understanding of how water flows through this environment that we're in, this mountain aquifer. And I think this illustration does a pretty good job of that, on how water flows through the system. If you'll notice that little house kind of in the center of it, let's not forget the septic system that's there. And that too is discharging wastewater into this environment that then becomes part of the subsurface environment and flows through the system. Well, I kind of lack a pointer to illustrate different things here. I think, as you study this on your own, you can kind of understand the water balance, the amount of water that enters the system, because that water is what's available to help dilute and also move both groundwater and the septic system effluent through the system. So we probably spend some more time here, but I think it's just overall to understand, how does water flow through the system? Typical of Indian Hills, Parmley, Gulch. Some places we have thin soils develop. Some places they're a little thicker. That term regolith means blanket of rock, soil. Those are the soil layer that we can see. Maybe in some cases it's highly decomposed or weathered bedrock. And then below the regolith, we're going to see the fractured bedrock, which which we have to remember that is the drinking water supply. Certainly for anyone that lives on a private well in the Indian Hills area or the mountainous portions of Jefferson County. That is the primary source of drinking water, is this fractured rock environment. So we want to remember that we're discharging this treated effluent, this treated wastewater effluent into this environment. And so that wastewater from the septic system will mix with the other water that's in the system. So just to look at the water balance, precipitation, about 17 inches per year. That's an average value from this 50-year model run, plus or minus a little bit. We lose a lot of water through evaporation and transpiration. Now, evaporation can be from free water surfaces, a lake, a river, whatever, or actually as the precipitation falls and catches on rooftops or impermeable surface. That's the evaporation part of it. The transpiration part of it is about 50% of evapotranspiration. Now that's an important component because that's water that is actually percolated into the subsurface environment and it's transpired through vegetation. In other words, that's uptake through grasses and trees and whatever's growing on the surface. So that we need to remember that portion of that enters into the subsurface environment pretty much at the same place that we're introducing the septic tank effluent, the leach into the leach field. So that too can mix with that water that is part of the transpiration, part of the water budget. Then a certain percentage actually percolates down into the deep fractures, and some of it's going to migrate laterally into stream flow. And then some of it will fill the fractures that have been depleted by pumping. And then a very small amount, you can see this groundwater sink is actually what leaves an upper basin and moves into a lower basin, kind of in a lateral direction. So that kind of provides a little overview of this hydrologic conceptual model of how water moves through the system and also how our septic system effluent moves through the system. You can see the house up on the very right side of the illustration. Boy, that may not have much soil up there to help with the treatment of the effluent. So in certain cases where we're not getting the extra treatment out of the soil, we probably need to use higher level treatment up front to make sure that whatever enters into the fractured rock system and the drinking water supply is probably is a better quality effluent, more highly treated with more of the nitrate removed. Next slide. Development in the Parmley Gulch Basin. As Jim mentioned, this was prepared for us by Planning and Zoning, and this gives a snapshot of what we see the development just a couple of years ago. This diagram shows the black line is the outline of the Parmley Gulch Basin. That's about 6 square miles, 3,700 acres. And the table down here, it's a little bit hard to read through this. I've got a summary table on the next page that'll help identify the features, the numbers that we think are important. But you can see that the Parmley Gulch Basin has been divided into 12 subbasins. The red hashed illustrates where the Indian Hills Prohibition boundary is, which does not allow for the installation of new, at this point, of new development. Then the blue area outlines the Indian Hills Water District boundary. So those, anything within that boundary, not necessarily all properties within that boundary are served by the district, but many of them are. I think the other thing I want to call out is, I think those are the main things, features on this map. I want to take this table that's down in the lower left corner of this map. We'll take a look at it in more detail to help us better understand development over time. Next slide, please. And this is just a summary of what you saw on the previous page. How large is the Parmley Gulch Basin? 3,600 acres. There are 12 subbasins. There are a little over 1,000 parcels, 1,100 parcels. And a parcel is property that's owned by a single individual that is going to get, it could contain many lots. There can be many lots within a parcel, but the parcel consists of contiguous lots that are under single ownership. So they're going to get one tax bill for that property. So that you can look at those parcels and say, well, that's how many tax statements are going out to the properties in Indian Hills. Occupied parcels, this tells us we're about 80% built out. How many of those were developed before 1979? Almost 700. How many developed after 79? About 200. And we could kind of use that to get a feel for what is the rate of development. If we've got 200 new developments since 1979, that's, I don't know, that's 40 years, almost. What does that really work out to be? An average of 5 per year, something like that. But point is, we can do that number and we can see what the development has been since 1979. Vacant parcels left. Well, there's about 200 vacant parcels left. 50 are in the prohibition area. 161 are in the upslope area or area outside of the prohibition area. And those, again, those are parcels, not lots. And then vacant parcels within the water district, there's 70. So this slide really is a good summary of where are we at with the development of Parmley Gulch and what remains to be developed. But also importantly is to remember there's 700 systems out there that were put in the ground before 1979. That's the existing infrastructure. That's the infrastructure that caused the nitrate pollution problem to begin with. And as Jim has mentioned, until we start to work on improving those systems, as we start to replace some of those treatment level 1 systems with higher level treatment systems or systems that reduce nitrogen, till we start to do that, the nitrogen problem will remain the same. However, I do want to add that we have been replacing them. As a matter of fact, there's about 80 high-level treatment systems in the Parmley Gulch Basin, and that's actually a data point from Margaret Herzog's study in 2016. So we know we have more of them now. Some of that represents new development, but some of that represents the replacement of some of these pre-1979 systems. So little by little, using this tincture of time approach, the old infrastructure is being replaced with new technology that discharges less nitrate into the water supply, into the basin. Next slide. So again, I want to repeat this again, and you're going to see this 3 times. And again, because why are we doing this? Well, we decided we've got nitrogen in groundwater that's coming from on-site wastewater treatment systems. Again, why do we need the policy? Well, the minimum standards that are set forth in our regulation aren't enough to address the problem. So we need something that's more stringent than the existing rules and regulations. We need these more stringent standards to help us address this problem. And again, we want to protect the groundwater system from further degradation as new development is brought online, and also to take a look at the existing systems and start to reduce the mass of nitrogen that's discharged into the drinking water supply. And so we want to use this kind of as a checklist as we go through the review of this policy and say, hey, is it achieving these objectives? Is it achieving the intended purpose? And our opinion is, yes, it's doing that. Let's continue, please. Oh, back up. So as we've discussed and we presented to the Board of Health and we back in July, and then to the community in September, Jim had mentioned that we've had proposals to say, you know what, I own land in the prohibition area. I'd like to develop it. And looking back at the 79 resolution, that's a no-no. And actually, as far as their most recent policy in 2014, we said, no, there's no how, no way, because we cannot have additional nitrogen discharged into the prohibition area. But then, we started to think about it and say, well, what if with new development, we could actually lower the mass of nitrogen that's discharged into the prohibition area? Is that even possible? What would that look like? How would that work? So this is how it could kind of work. Let's say in the prohibition area, there is an existing 3-bedroom house on a half an acre. And this is actually this is one of the cases that's been presented to us. So we don't have to imagine this too much, but so we've got this existing 3-bedroom house on about a half an acre, and it's got a TL1 system. Well, we know what the amount of nitrogen is discharged from a TL1 system. And the owner of this property says, hey, well, here's my proposal. What if I take that existing TL1 system and I replace it with a TL3N system? It's going to put a lot less nitrogen into the ground. I can remove the amount of mass that the old system, or lower the amount of mass that the current house is putting into the basin. And then if I do that, then I'd like to build a new 4-bedroom house on 2 acres with a treatment level 3N system. So that's the proposal, but can we demonstrate that it actually reduces the nitrogen load, the amount of nitrogen that's being discharged from septic systems in the prohibition area? Well, let's check the numbers and do the math. Next slide. Here's how it happens. The current development, which is this 3-bedroom house with a TL1 system, discharges about 13 pounds of nitrogen into the groundwater system. The proposed development is to take that TL1 system, replace it with a TL3N system, which is going to reduce the amount of nitrogen discharged. In fact, it's going to reduce it by almost 10 pounds. It knocks it down to about 4 pounds per year. That's the amount of nitrogen, that's the load of nitrogen that's discharged in the prohibition area currently from this 3-bedroom house. Now we put in the new house, the nitrogen load from the new 4-bedroom house with a TL3N system, that's going to discharge almost 5 pounds per year. So now when I do the math and I add up those two, 4 pounds from the 3-bedroom house and 5 pounds from the 4-bedroom house, I come up with under 9 pounds, but about 8.8 pounds of nitrogen that's being discharged. Now go back to the current development and we see we've got 13 pounds being discharged right now. And if we can knock that down to 2 houses that only put out a total of 8 pounds, by golly, we've reduced that nitrogen mass by 5 pounds per year. So we actually have achieved a reduction in the amount of nitrogen that's being dumped into the drinking water supply. And that represents a 37% reduction in the nitrogen load to the groundwater system compared to the current development. So I think that one checks off the list as saying, gosh, we are actually taking a step forward in the prohibition area. Hard to believe that new development in the prohibition area, done the right way, can actually start to reduce the amount of nitrogen that's being discharged into the prohibition area. Next slide. So groundwater nitrate loading model, this next slide, please, helps kind of support this concept of how can we start to knock down the nitrogen that's being discharged from existing homes. If we take a look at our existing table 4.1, that's kind of what we have in there right now is 5-acre minimum lot size. Unless you meet certain requirements, you can subdivide down to 3.5 acres. But that's with no nitrogen reduction, 5 acres and 3.5 acres. So if we start to change out those systems and put in treatment level 2N, well, that provides 50% nitrogen reduction. And you just take the values that are in the left column and reduce them by 50%. And that's just saying, well, a treatment level 2N system on a 2.5 acre property puts out the same amount of nitrogen as a system that doesn't have any nitrogen reduction on a 5-acre property. Now we can do the same thing with the rightmost column, treatment level 3N. It reduces the nitrogen by, that's actually wrong number up there. That should be 71% nitrogen reduction. My apology for that. I didn't catch that. So where you see 29% reduction, please read 71% reduction. So because treatment level 3N even provides a higher level of nitrogen removal, then that fits with an even smaller property. So that's just doing the math based on our current standard of 5 acres lot size or 3.5 acre lot size with treatment level 1. As we start to put in these nitrogen reducing systems, TL2, removing 50%, and treatment level 3, again, my apology, that should say 71% nitrogen reduction. That's how the lot size would compare. So what that means, bottom line is this, that a treatment level 1 system on 3.5 acres is roughly equivalent to the nitrogen load for a treatment level 3N system on 1 acre. Next slide. So we developed this model, mathematical model. It's a very simple mathematical model. And these are the inputs that go into it. And I call these are the environmental inputs. So if you reflect back on that conceptual model of the watershed that we had showed, that showed the fractured rock aquifer and the amount of water and how it flows through the system, this is where these inputs come from. You know, we need to look at, well, how much nitrogen, as we go through these check marks, how much nitrogen does each person discharge into the groundwater system? And when we look at the treatment systems, the next one, how much nitrogen is removed by each level of treatment? Does soil contribute to the attenuation or reduction of nitrogen? How about precipitation that can dilute the nitrogen to lower concentrations? What is the, as we talked about that hydrologic conceptual model, what is the fate of precipitation as it enters this groundwater system and gets into the mixing zone, into the soil zone, where it's going to mix with the effluent from the septic systems? And then really establishing what is our groundwater goal? What is the number that we do not want to exceed? So in this model run, we if you can take a look at variable F, you'll see the value next to that in blue is 8 milligrams per liter. And how we derived 8 milligrams per liter was we said, well, we know the drinking water standard is 10, and we're going to assume that background concentration of nitrate is about 2. It's probably closer to 1, but this gives us a little bit more safety. 2. So then if we take 10 milligrams per liter that we don't want to exceed minus the 2, that's the background concentration of nitrogen, then we come up with 8 milligrams per liter. That's going to be what's going to kind of limit the model and how much nitrogen load the system can handle. So those are the values that are put into the equation. Bottom line, when we have the values, these inputs for nitrogen per person, the treatment that the system provides, the soil attenuation factor, how much precipitation helps with the dilution of the nitrate, how the precipitation and water, groundwater moves through the system to mix with and dilute the nitrogen load. And then we have our groundwater goal. This model with those inputs says we need about 1/4 of an acre, a little more, 1/4 to 1/3 of an acre per person to keep the nitrate concentration, to achieve that nitrogen concentration goal of 10 milligrams per liter. So that's the bottom line here, is based on this model. Now you can change some of those input parameters. We feel that these input parameters are fairly reflective of average values that we see in the basin. Some areas, and I think it was Kimberly had said this, gosh, many years ago, she said, well, doesn't it really depend on the quality of the land? And when we're talking about the quality of the land, the features of the land that the system is going to be put in. And that was right on target, very, very astute, right on target. Yes, you really can get down to a site-by-site evaluation, and you could dial this model in a little bit better based on those site conditions. But at this point, we wanted to just start with what we feel reflect general values for the fractured rock aquifer in the mountainous parts of Jefferson County. Next slide. All right. Well, then the question came up, well, how big a house does that really support? Does it change? What if I want to put a McMansion on a very tiny lot? Or I want to put a tiny house on a very big lot? Well, that was a really great question. So we did tease a little bit more out of the model and said, well, how does this look? And if we're really going to base the treatment level based on the lot size, we should also maybe consider how big is the house going to be? And more importantly, because remember, houses don't poop, bedrooms don't poop, people poop. This is really about the number of people that a lot can support if we want to achieve a certain nitrogen goal. So we take a couple of examples here. Let's say a 1-bedroom house with 2 people. We can look, just walk down the list with me. We'd say with treatment level 1, 2, or 3, which does not reduce the nitrogen, based on this model, you're going to need about 2 acres. With treatment level 2N, remember I said that provides about 50% reduction, down to 1 acre. With treatment level 3N, you can get down to about 0.6 of an acre. Remember, even though I had it wrong on the slide, treatment level 3N, and I got it wrong on this slide too. Oh no, this one's right, because it says nitrogen remaining after treatment. That part is true. That's how much nitrogen remains after treatment. For treatment level 3N, it's 29%. That's the line in purple on this chart. So now we come down to the 6-bedroom house with 9 people. Again, treatment level 1, going to need almost 9 acres. Treatment level 2, drop down to about 4 acres. Treatment level 3N, about 2.5 acres. So if we want to take this model to the next level and say, well, how big a household, or how many, really truly, how many people can this property support? This expansion to the model helps us understand that part of it. Next slide. Okay, just wanted to repeat these, or again, not repeat, but the policy requirements in the prohibition area. New development must demonstrate that they're going to reduce the nitrogen mass load, period. That's it. No new, if you cannot demonstrate that you're going to actually reduce the nitrogen loading into the prohibition area, you will not be allowed to develop. You must prove that you're going to reduce the nitrogen mass that's being discharged into the prohibition area. For existing development, in most cases, when you're replacing or repairing, when the replacement or repair of an OWTS is required, in most cases, you're going to need to upgrade to nitrogen reducing OWTS. And I say most cases, maybe it's all cases, but the point is, the overwhelming number of systems, the existing systems, the old infrastructure, when it needs to be repaired or replaced or upgraded, whether you're adding a bedroom or something, you're going to need to replace that TL1 system with a nitrogen reducing system. Outside of the prohibition area, new development, we've got treatment level based on lot size. 4 acres or more, treatment level 1 is probably sufficient. 2 to 4 acres, treatment level 2N is required. Less than 2 acres, you're going to need to bump that up to treatment level 3N. Existing development, same as in the prohibition area. In most cases, when you need to replace or repair the existing OWTS, you will need, depending on the triggers, you will need to upgrade to nitrogen reducing. So this does honor the model that we have throughout the base, the model that we developed. And it just says, our goal really is to take a look at new development and make sure that they're discharging the minimum amount of nitrogen possible based on lot size. But there's also these triggers in place to say we've got to take care of that existing infrastructure. As I mentioned, those 700 to 800 systems that are in the ground, that were put in the ground before there was nitrogen removal technologies in place. Until we address those issues, until we address those systems, the problem will remain. And one might ask, well, do we go for a rip off the Band-Aid approach, or do we go for a tincture of time approach? And we feel it's much more prudent and reasonable to go with a tincture of time approach and allow these systems, as they come into view, that need to be upgraded or that need to be replacement or repair, to slowly but surely be upgraded to nitrogen reducing systems. Over time, that will lower the nitrate load that's discharged into the Parmley Gulch watershed. Next slide. Again, this is just our final checklist. What's the basis of this policy? Well, we got to take care of the nitrogen problem. The current standard, the standards and the regulation aren't enough. A policy is needed to provide more stringent standards. This policy does do that, and it'll achieve its goals. We're gonna protect groundwater from further degradation, and we're going to reduce the mass of nitrogen discharged. Certainly, as the existing infrastructure slowly but surely, as needed, is upgraded to higher level or nitrogen reducing technologies. I think that's it. Thank you.
All right, we're going to have Mitch kind of walk through the policy document that was shared with the board, and then we'll take some time to answer your questions if that'll work for everyone. Go ahead, Mitch. Are you muted?
Yep, there we go. Trying to find the unmute.
Okay.
All right. So before you should see on the screen a copy of the policy that was provided to you. Just kind of want to walk through this a little bit. And so we have our statement policy, what we want to do here, and then the definitions. I won't highlight that too much because I want to kind of get into more of the meat and just kind of really bring home what Jim and Roy have set me up for. So the first paragraph or the first section of this policy is looking at new on-site wastewater treatment systems in the prohibition area. So again, back to what Roy was saying, that we're looking for that prohibition of discharge of additional nitrate, and then also looking to reduce that nitrate into the prohibition area. So what we're looking at doing here is using that table that Roy had just talked about, using that model to apply to new installations of OWTS and the prohibited area. So to kind of really briefly sum this, the way that we would like to come across is we're allowing for the development of development in the prohibition area, as long as that development is reducing the nitrogen that's going into the watershed. And we set a minimum of 25% of the net nitrate mass. And that kind of comes from that math that Roy had just showed us. This is also using the goal of the 10 milligrams per liter. And I know we can play with that. Again, it's a model. We can look at that, but we've gone off of what the EPA level has deemed as the maximum contaminant level for nitrate. We also have some caveats to that, where that it's a subject property if they're more than a mile apart from each other. So if you're doing a development and you, like in Roy's example, and you have another property that you're looking to develop and you have the higher level treatment, we would like them to be having some impact on each other. And so we came up with the 1 mile apart, or that it's in the same neighborhood subdivision, a location that drains to the same part of the prohibition area. We're also looking at that amount of land that's needed. And as you saw, that's also part of the model, one of the factors. And so we have that if the property consists of 2 or more lots, that we'd like those properties to be merged into a single parcel. That way we are basically keeping those lots together, and it doesn't have the allowance for those lots to be subdivided smaller in the future. And then we also go into if the property owner desires to remove or replace an existing dwelling. Basically, this paragraph says that there must be nitrogen reducing higher level treatment added to any replacement. And then it also has to be where it meets and exceeds the requirements of section A, so of this section, but it also cannot have more nitrogen being released into the environment than what was previously allowed. Section B is similar, but it's focusing on the upslope area or the hybrid area of the Parmley Gulch. And so with this one, we took an approach of still using the model, but we're saying if it's less than the 2 acres, we're now creating a tiered system of treatment levels. So smaller lots would need a higher level treatment. And so the 2 to 4 acres would be need the minimum of TL2N, and 4 acres or more would need at least a TL1 system. We do have a caveat also that the smaller properties, so basically less than 1 acre, will not be approved for a permit unless the proposal demonstrates a net reduction of nitrogen mass loading to the watershed. So what we're trying to do is balance the development of those properties that have already been legally created, and then also make sure that we are keeping that nitrogen loading into the system or into the environment as in compliance with the resolution. And so that's the no more nitrogen loading to this watershed. Section C kind of brings home repairs and replacements of existing OWTS. So the 2 is supposed to focus on the new developments, and then the C focuses on anything that's being replaced or repaired. And that is if an existing OWTS does not include nitrogen reduction, that the OWTS must be upgraded to include that now. And that would be based on the table in section B above. So for example, if you're replacing a system and you're on a 2-acre property, your minimum treatment level should be at least a 2N. Also, we have the caveat that if you are replacing a building and if you are doing a remodel, I should say, and if you have more bedrooms or you create a stronger waste stream than what was there, that you again must demonstrate a net reduction of nitrogen loading to the watershed. So those are the 3 big pieces of the policy, or I feel the 3 big pieces is looking at the new construction to make sure that we are not creating more nitrogen, that we're putting in place a way to reduce the amount of nitrogen for both the prohibition area and the upslope areas. And then also for looking at those properties that are already existing and what we can do to reduce that nitrogen load there. As you saw the numbers from Roy's table or from the watershed in the map, that most of these properties are already developed. And so these are the areas too that we feel that is going to be the bigger bang for our buck when it comes to the nitrogen reduction as well. Some items to help us clean up on this. So properties applying for building permits, Jim had touched on this, but when they do apply for a building permit, and it affects the living space, is that we do have some referral in that, and that the system must meet capacity, and it also must be upgraded to the standards set forth in this policy. While not quite impactful on the nitrogen loading to the watershed, it helps us identify and helps us collect that data to determine how this policy is working. But the well water testing for all OW permits issued in the Parmley Gulch, and so we're able to do this at the time of transfer permit, or sorry, use permits on the transfer of title. Sorry, we also have the construction and repair permits as well. So we are hopefully creating more of those data points and demonstrating that the policy is working. Same thing with use permits or transfer of title permits. So the way that the current regulations are written is that approval for a use permit does not hinge necessarily on compliance with the regulations, but whether or not, in short, the OWTS is malfunctioning or functioning. And so if there's malfunctioning components, they must be repaired. If there's no records and we don't have anything of an idea what's kind of out there, as long as it's not malfunctioning per the regulations, it's still allowed to get a use permit. We feel that within the Parmley Gulch Basin, that if you have an undocumented system, that really we need this to be documented and then come into compliance. So this section here is basically if you go for a use permit and we don't have records on that, the OWTS must be evaluated so that the size is correct. And if not, then it needs to come into compliance. And then same thing, if anything's malfunctioning or damaged, those also need to be repaired. At this time, if it's a documented system, but not in compliance, so meaning that it's designed for a 3-bedroom home, but there is a 4-bedroom system on the property, we are not requiring that to be brought into compliance with higher level treatment at this time. It's one of those things, like Roy said, the tincture of time. We will go ahead, we will address those, but we feel that for the most part, the bigger sources that we want to get identified are the ones that are undocumented. Cesspools with the regulations and the statute must be abandoned and replaced when a conforming OWTS is discovered. So we need to get those. Again, that's our biggest source of pollution, that's untreated effluent going into the environment, getting that out of there and getting those taken care of. To kind of clarify on the repairs piece, so when it comes to tank replacements, we wanted to clarify that our policy is that during a tank replacement, that is usually when the higher level treatment units will be installed. That is the component of where they are, where that equipment is. And so as you're going in to do a tank replacement, that would probably be a great time to go ahead and get that system upgraded. And so in short, the philosophy is let's get that effluent treated, regardless of kind of where that's going. So what we've decided and what we're proposing here is that during a tank replacement, based on the amount of property size that you have a higher treatment level system that would be required. But that's also assuming that the soil treatment area pretty much it meets the setbacks. It is not in a state of failure or malfunction. It is not a cesspool, a pit privy, or there are no records existing for that. So there may be some site evaluation that has to go on to identify that the soils and that the STA is okay. But at least we're again trying to work towards reducing that nitrate loading going to the watershed. Along with cesspools, pit privies is another one that's the high polluters. There don't know how many, to be honest, are out there in Indian Hills that are existing, but go ahead and get rid of those and work to having those become vaulted privies where at least that waste is contained. Pit privies are mostly intended for limited occupancy residences, so I'm hoping we won't see a whole lot of those, but again, it's one of those things where we can reduce the amount of nitrogen that's being introduced into the watershed by getting rid of those raw effluent sources there. Vaulted privies and wastewater vaults, same thing, those things have been around for a while, and we just want to make sure that those are found in compliance. And they can be converted to, I guess what we're seeing sometimes is that they are converted to, I guess the original intention for limited use occupancy again, and it's kind of that weekend cabin, that weekend getaway, which is much of what Indian Hills was originally intended for. But what we have seen with the way the housing market has gone is a lot of these part-time use occupant or limited use occupancy dwellings have become more of a full-time use, and so people are making modifications and upgrades to them, and so trying to keep up with that as well. If you're on a vaulted privy, if you add water carried fixtures to that, that again it can only be used for limited use occupancy. Some additional notes on this is that we will review and approve all the application for OWTS unless minimum lot sizes are not met, or the proposal is for a TL1 system when the policy requires an HLT system. So a permit application for those that do not conform to the policy will be denied by us, and appeals of those permits may be heard by the Board of Health per the regulations. So in short, if they don't feel that they want to follow this policy or can meet it, they do have the right to come before you as a variance. And then also just a clarification that minor repairs such as replacing broken pipes, distribution boxes, lids, tank lids and stuff like that are exempt from permitting requirements and wouldn't necessarily trigger some of the repairs here. That is mostly that is the policy. The attachment A identifies which lots are in the prohibition area. We haven't changed anything with the lots, which ones are in, which ones are out. Attachment B is the summary of the model that Roy had just presented on. So that is the policy there altogether. At this time, welcome any questions on the policy.
Members, any questions for staff? I have one on, this goes up back, I think Roy had shared, I don't remember the exact numbers that you said, but you had a breakdown of how many were installed prior to 1979. And my interest is how many of those have been replaced in over, that over 40-year time frame for those. So, I mean, to me, that's probably past the life of most of those systems if they're 41 plus years old. How many of those have actually been replaced in that time?
So, Lane, thanks for that question. Don't have a number for you, but I think that's a great data point that we should come up with. I really couldn't hazard a guess. I know some have, but it's probably in the tens, dozens, if that. And remember, some of them were replaced under standards that were in place from 79, through 2000. So some of them have already been upgraded, but they only had to comply with those standards that were in place during that, 20-year period. So some have been upgraded, but I think that's a great data point to look at. Can't give you a number today.
I think that's one of the big pieces for me is the existing systems are the problem. We're looking for the new systems to be part of the solution, but going back to those, 688 pre-79, I guess being more proactive at finding out, again, you said you're not sure how many maybe have no record at all. To me, those should be the priority, is finding out what is actually there if there's no record. And maybe we are more aggressive at requiring them to come in versus waiting for them to actively fail. We already know that there's an impact to the groundwater system. So waiting for the system to surface to be the prompt to make them fix it, it doesn't feel like we're being as proactive as we should.
Well, I think that just keep in mind that, yes, so the answer is yes, I agree with that. Let's find out the ones that are undocumented or find out the properties where we don't have any records. But as Mitch pointed out, that our use permit program is highly effective. And, anytime a property goes up for sale, I think Craig did some analysis for us there. Most of those properties are pulling a use permit, and that use permit program is helping us find those systems. So I think we can augment the use permit program with, as you've suggested, let's see if we can come up with a list of let's say the oldest OWTS systems and/or where we know we have a residential structure and yet we don't have a OWTS record for it, or septic system record for it. Let's try and see if we can tease that out and find those.
And if I may, Lane, kind of clarify if I heard the question correctly. So during a transfer of title, if there's no records, that's the time that we would catch those without records. If there's a repair, replacement, or malfunction or anything like that, there's no records, obviously, they'll be coming in for a permit for that. I think for me, most of the only time that really, if it's no records and we don't have any changes or anything going on with the property, kind of thing, status quo, that's about the only time that we wouldn't really be getting into making them upgrade anything. If they come in, again, working with the building department, if they're coming in for building permit for any kind of remodeling or building permits to a living space and they don't have the records, we would again be looking for them to upgrade that system. So it's kind of in my opinion, it's the sleeping dog, let the sleeping dog lie. So for now, those are the ones that haven't come to that threshold of being triggered to have to do the upgrades.
Yeah, again, I think we've let it lie for over 40 years and we haven't seen it improve the wastewater or the overall nitrate levels there. So to me, I think there is a need to be proactive versus just wait for people to finally sell or wait for them to finally fail. Again, that's the piece that I think is missing here. I like the idea. Sorry, Jim, I just finished this. I really like the idea of the sort of the offset or trading, where one person is recognizing the opportunity to build in the area, somebody else who may not have the financial capacity to change their system, and they overall are reducing the loading. That's fantastic. That is that proactive piece, and it's taking advantage of somebody who has maybe the finances to help support fixing somebody else's system. But otherwise, just sitting there and waiting to inherit it to another person, and it feels like we're missing the problem. We're looking again at the new people to help solve it, versus the people who've been there for over 40 years and have not fixed things. So go ahead, Jim. Sorry.
Just a quick note that this process has revealed a number of things to us in terms of our regulations, and I think there's definitely room for improvement in terms of the the purpose and the goal of the use permit program. I think over the years, as Mitch mentioned, when we did use permits, it was whether it worked or not, and not whether it met some sort of standard or not. So I think this is a good first step in trying to identify how close are they to meeting standards, and if not, what do they need to do to bring it up to snuff.
I think that point that Roy made several times is the existing standards were not adequate. So to me, again, we know that that's the case because that's why we have this problem here. So to me, not fixing, again, those existing systems, it means we're still not addressing the true problem.
And this is a kind of a next of several steps that have occurred over history to get us towards closer to that. So, but I agree, we need to be more proactive, perhaps a little more aggressive in some of the aspects of our program.
Board, any questions for staff?
I'm just totally impressed with the work that has gone into this. I'm overwhelmed, so no questions.
I don't have any questions, Lane, but I do want to thank Jim and Roy and Mitch for the work that you have done. I understand that we have years ahead of us to correct, if you will. For me, I know Lane said we haven't seen a reduction, but what is good for me to hear is to see that we've held where we've been at. And so I know this is hard work, especially because you got to do math in it. So thank you. Great work. And I look forward to how we move it even further along down the road. So thank you.
Thank you. And I have to thank Roy for doing the math.
I just want to point out, Kimberly has been able to join us. So thanks, Kimberly, for joining us. I know she was asked to join a meeting for the commissioners. So she had sort of two assignments at the same time. So we appreciate you fulfilling that for the board and then being able to join us. So at this time, would any of the board members like to make a motion on this proposal?
I would move the proposal that the board go ahead and adopt the documents before us, the proposal.
Second.
Motion in a second. Any additional discussion on the proposal?
I just want to make one comment. This did take an incredible amount of work. And I know that, Jim, you and I had a conversation, and it's always like, it feels like it's really over my head. So thank you for doing this document and putting it into something that was much more easy to understand, and all the work that you and your team put into this. I do appreciate it. And this is a great starting point. I mean, we know it's going to be tweaked down the road. That's what you do. So thank you.
Thank you, Sherry, and to all you, the board members. Anything we can do or offer to do to help you continue to gain knowledge in this topic. This is one of the few environmental health topics that you all have a lot of authority to deal with. And so the more we can do to help you understand and learn the science and learn the system, the program, we're happy to do it.
I know one of the points, I also want to echo my fellow board members for all the work. This has been many years since I've been on the board. We've been trying to get to a resolution. So while I feel it's been too slow for us, we're not 40 years in the making either. So it's been a long time to get this addressed. There was a component that talked about people who still don't meet this policy can come before the board for a variance. So I guess I'm concerned, what conditions that aren't being addressed here do we still want to see and hear variances related to this? So again, now somebody's saying, well, I have 0.6 acres and I want to build, the 2-bedroom house and I'm going to put 3 in. So can you approve that? So can you sort of share with me the rationale for the I guess, ongoing still variances related to this.
Yeah, let me try to clarify something here. The language in the policy says that we can deny the permit application for anything that doesn't meet this, right? I'm paraphrasing terribly, but the idea here is that, and you may know this, Lane, that if we deny a permit, any applicant has the opportunity to request a review by the Board of Health. And I'm not the attorney, but I would suggest that that means that someone could bring a request back to the board to review our decision to determine whether we actually followed the policy or there was some discrepancy. It's not about a variance. That's a whole different process than what this particular statement and the additional note says. It says review appeals for permit denials be heard by the Board of Health. That is a function of the Board of Health under the on-site wastewater regulations.
Yeah, and that's good. I thought Mitch had mentioned something about people can still come before the board for a variance. So
I think that was a bit
That
of
was
a
my mistake.
misstatement. Yes.
Yeah.
I feel a lot more comfortable then, because again, I feel like we put a whole lot of work into a policy that still allows everybody to still apply for variances to it.
We were very aware of that concern, and we tried to build this in a way that avoided that situation.
Great. All right. Any additional discussion? All right. Take a vote. All those in favor of adopting this policy?
Aye.
Aye. Aye.
All right. Unanimous approval.
Thank you,
staff. How are folks doing? Do you need a short bio break, or are you, was that a yes, Kimberly, or someone? All right, how about we take 5 minutes and then we'll jump back into new business. So 6:32, we will resume. All right, board members, let me know if you're back.
Back. Oops. Back.
Sherry, looks like you're back. And Harriet, are you back?
I am back. I'm sorry, I'm a little slow.
Thank you. All right. We'll resume and we'll jump into new business. And I think we're sticking with a theme here. We have on-site wastewater treatment system contractor licensure hearing. And Mitch, I think you're leading this.
That is correct. Thank you. Are you able to see my screen again?
Yes.
Should be the PowerPoint. Okay, perfect. So just kind of want to come forth today. We have an on-site wastewater contractor license, just kind of like to discuss. We need some enforcement on it. Since this is a new process for me, and I think for many of the board as well, I just wanted to take some time to actually a few minutes and go over our permitting process to help us kind of understand our process and then kind of where we're coming from with where this goes. So out of context here, I used to teach on-site wastewater up at CSU as a guest lecturer, and so these slides come from that presentation. So kind of why you might see some of it looks a little bit different than what we normally have. But anyways, let's see. Advance, here we go. Okay, so for the permit process, the way that it works for us is that they come in, they submit their application, and that could be the property owner, it could be the engineer, it could be the contractor. As long as we just get the application, that includes a fee, a form, and then a copy of the design. Once we take that in and we have that put together and into our database, our inspectors will go out and do a site evaluation, and they'll do a design review of the design. If that all meets the regulations and we think it looks good, then we're going to issue the permit for them to go ahead and do the work, to construct, install, alter, excavate, all of that. As they go through the process of completing the work, they'll call us in for certain inspections, and those inspections are on the permit. After the inspections are completed, the engineer that designed the system will sign off on that and certify that they've done that. So kind of quickly, again, this is the same thing, but these are the inspections. So that first one that we go out, we do a soil evaluation, or sorry, that we do the site evaluation. After, so that helps us look at the site, and then I'll get a little more into detail with that. But that basically leads to the permit being issued. Once the permit's been issued, we'll have the open hole. If there is an STA, we'll have the final component. Sometimes we'll have a final grade inspection, and then again, that engineer certification. So what we're doing on that site evaluation during the open hole, they have test pits dug, and what we're looking at is the soil. So soil is kind of one of the big components of what we're looking for, of how to determine the size of the STA. We just kind of covered that a little bit in the last presentation, but this is kind of where we're out there getting to play in the dirt to kind of determine that. And so this picture here just shows Roy teaching us what we're doing when it comes to the soil and kind of how we classify it and look at it. And then you can kind of see this is a chart that Roy, myself, and Doyle Harrison had created to try to help inspectors work through the different types of soils. So that's kind of what we're doing on the site evaluation and trying to understand what's out there. So a couple pictures. So these are some pictures that taken from a couple of the various sites that we've been at. So here's one, it's fairly rocky, as you can see. And so again, back to kind of the conversation previously, there's not a lot of soil there, so it's not going to be as much treatment. There could be a lot of water movement on that one. This one's a little more of a clayey type soil. As you can see, it kind of sticks together and forms these nice ribbons. Same thing, here's another one of the soil test pit that has, you can see the smearing in the walls, and that's kind of where they took the bucket, and you can kind of see how it gets compacted, and it's a little bit of clay to it. But then another thing too is we're looking for is they've dug these holes and then we had groundwater or we had water as an issue. And so that also is an indication that's something that we need to do differently when looking at the design. And then we also have weather. And so this one is very much a rocky type soil. You can see by what we call the spoils pile here, because we can't get down there and see the actual side walls of the hole because of the weather there. So that's why we like to get out there and look at the soils on the site evaluation. We also look at setbacks. That's the other thing we're looking at. So here's one that's from the well to the corner of the leach field. They were 191 feet. Sometimes not everything was identified. So here's a well that we had found that was not marked on the site plan. As you've probably seen your share of as the Board of Health, we get difficult sites. And so there's slopes, trees, road cuts, lot sizes, a lot of different factors that can go into making a site challenging to work with. This is one, they proposed to do this here in this person's front yard, but if you can see, there's some blue flags off on the right, that's the water line. And then off on the left, there are some yellow flags there. So we have some utilities here that were located after they'd kind of gone out. So that's another reason we're out doing the site evaluations. And then this one here is it's a system that was put in that is too close to the stream there. So that's the site evaluation, and that's again where we're out there looking at the conditions on the ground. We'll come back, we'll usually do the design review, look through design, make sure that the components of the regulations that are required to be there are there. And so then if that's all passes, then we'll give them their permit and then they can start work. So typically if your traditional system where it includes the installation of a septic tank and a leach field or the STA, the first inspection we're usually going to come across is the open hole. And the open hole is just that. It's a large open hole, but it's our chance to kind of see really what is down where the soil is going to, or the treatment is really going to happen. And we get this better chance to see what the soils look like. So here's the open hole. You can see there's a shed right next to this one. You can kind of see on this one the really nice layers of the different soils that we'll be working with here. Here's one that's an open hole where they were doing a replacement, and this black slime that's kind of off on the right side of the picture there. That is the old system, the biomat and the buildup from the old system that's leaching into the new hole that usually gets all cleaned out. On this one, the open hole may have looked, or the profile holes may have looked nice, but once they dug the open holes, you'll see that there are some large rock formations that were subterranean there that also would impact and impede the treatment. This is another one where the open hole was dug, and then we had some water issues. So those are the things that we want to see when we're looking for with the open hole. And again, it's just another check to make sure that where all the treatment really, or most of the treatment, I should say, of the effluent's going to occur, that this is really the ideal location for that before it gets back into the groundwater. I don't really want to focus too much on this. I guess these are the components. So these are some of the things that we're looking for when we go out and do these inspections, but with septic tanks, we're looking at levelness of the tank. This one here is they used a spray insulation as a sealant, so it needs to be watertight and it needs to be an improved material. This one is the tanks are, if you can see, there's water that's at the bottom of this, so it's high groundwater, so these tanks needed to be anchored so they didn't pop up out of the ground. Installation practices that when they're being backfilled, that they're doing it properly. This is a effluent filter, and you can see it at the bottom of the tubing there. There's the top of the handle. That handle is probably about 3 to 4 feet down from where the top of the grass would be, or the grade. So to make that serviceable, that's really hard to get down there to do that. So we're looking at that when we're out doing our inspections. And the same concept here. So this is a septic tank. They didn't have risers for that tank, and those would need to have that riser to again, be able to find it and service it. On your soil treatment area, on the component inspection, we're looking for, this is what's called a non-pressurized drip dispersal system, but we want these to be shallow. This is at its highest point was about 4 feet deep. And so that wasn't installed properly. So we're looking for issues like that. This one, the system got installed, but then with the temperatures, the plastic chambers here, they got brittle, and I was told that deer walked across this, punching holes in the chambers. So just making sure, you know, the items that are going in are still, the integrity is still there. This one might be a little bit hard to see, but it's not as big an issue, but we're looking for levelness. And so these chambers were installed very uneven, and you can kind of see the ridges and runs through them. So those are the component, those are the open hole, the inspections, the big ones. And then after that's approved, they'll do the component where they go ahead and they install all the components in. And really what we should see on a component is something like this. On the left side, everything's ready to go, it's ready to be backfilled. And then if we need to be, then we can go back and we see final grade. So you can kind of see it makes it hard and difficult if we don't get to see the open hole, what's underneath, how things were installed. If we sometimes just go ahead and go straight to the component, or sometimes we get out there in the final grade and components are already buried. So that's just a quick overview of what our inspection process looks like. Kind of switching gears here, like to get back to a little bit of why we're here. And so just to kind of go off of some of the regulations. So today, what we're here for is because of a systems contractor, and our opinion is not following the regulations. And so just wanted to put the definition out here, well, who a system contractor is. That's the person that's engaged in and holds himself or herself as a specialist in the installation, renovation, and repair of the OWTS. And I kind of put the definition here because then we have a whole section 7 on licensed contractors. And so the first part of it, they have to hold a valid license. The second part of that is, in order to get that license, though, they have to pass a test that demonstrates their knowledge of this regulation. And then the third part, those licenses are good for 1 year. They coincide with the calendar year and they get renewed every year. Next part of it is section D, and that lays out in the regulations the minimums of a system contractor requirements or responsibilities. And so making sure that you have a permit before you install the OWTS. There's an inspection card that goes out on the property, or that we leave on the property. It's kind of a communications card. And so making sure that that's there so that they're informed of any requirements that we may have had or the engineer may have had before they backfill. Verify there's been no changes in the site conditions. So is there anything that we need to go back and we need to take a look at and talk about, because the design may have changed once we dug that open hole or once we started doing the component installation. Also need to perform the work in compliance with the regulation and conditions specified on the permit. And then suspend any work and notify the health officer if there's any change in site conditions or anything that would basically, and any other conditions otherwise provided in the regulations. If they don't do that, the board may revoke, suspend a systems contractor license for failure to comply with the regulations. And so revocation suspension shall take place only after a hearing before the board, which is why we are here today. And then the license holder should be given no less than 10 days notice of the hearing. Also, the board may lift the suspension or revocation after a hearing, which is determined the systems contractor has corrected or rectified the conditions that caused the suspension or revocation. So that's what regulatorily is required of the system contractor, and then what is allowed for their license. So to get to the case that we're hearing today, we started tracking deficiencies or violations of contractors and cleaners back in October of 2020. It's something that we've kind of had issues with for a while with various contractors, and we haven't really tracked them. And so we created the spreadsheet and said, you know what, we're tracking these. And so we started issuing notices of violation to contractors when multiple violations occur. So what we've been doing is, now that we've been tracking them, we've been watching, have they been repeating these violations? And if they have been, then we are sending them the notice of violation. So in this case, what we have here for permit 20-126366 is a final inspection was requested to our office on November 20th. November 24th, 2020 for the final component, but the open hole inspection had not been conducted. And so that's kind of why I gave you that background of how this process works and why we go through the steps. And so we missed a whole step there. On permit 21-103-336, the same thing. We have received another request for a final inspection. So as you can kind of see, we're trending that again. So we got the first one since we started tracking on November 24th. It happened again on March 8th. And so at that time, we went ahead and we sent a notice of violation to the contractor about that. Then for permit. Sorry, it looks like I just got muted here. Okay. So then for permit 21-1300088, the final inspection, same thing happened again. We were requested for a final inspection, but the open hole inspection had not been requested or conducted. And then kind of a different one, but it was that same time, there was 21-133431. The inspections were requested, but a permit had not been issued yet. The permit was issued October 26th, but the request for the inspection was called in on October 25th. And so for that, we issued another NOV, or the notice of violation. And that is kind of on that one where we said, we will be taking you before the Board of Health for that. And so we were originally gonna do this in December, but had to delay that. And so we're here today in January for this. So for the enforcement case against, for permit 20-126366, a couple of screenshots here from our database. So if you'll notice that the dates for the top one is the database for the open hole. The bottom screenshot there is the database for the entries for the final component. And so on this one, our inspector made note that the open hole was not called in. And you can kind of see too, the dates there show that these were both entered in on the same time, because when the final was called in this case, Madison was out there, did the inspection for both the final and took what she could for the open hole. The enforcement case here for this is a copy or a screenshot of the permit. You'll notice I changed everything to a permit number, or I've been using permit number, then I redacted here addresses just for sake of the people whose property this was. Trying to keep that somewhat a little more anonymous here, but right here in yellow, I wanted to highlight the inspections required. Type of inspection was an open excavation. That was not called in. So when our Madison in this case went out there to do the inspection, this is what she found. I want to note that this was for a repair, and so we did want to definitely see what was underneath there to make sure that when the open hole was done, or the STA was, the new one was put in, that everything was underneath was okay, and that we aren't going to be getting ourselves into another malfunction situation again. Same thing, just as for the other property 21, or the other permit 21-103336. Same screenshots here. They were both entered in on the same date because the property, or the request for the inspection, came in on March 8th. And so when our inspector, in this case Mary, went out and did her inspections, found that the open hole had not been called in, but there was already the components installed in that. So she did her best to make notes of what she could see. Again, here's a copy of the permit, screenshot showing in yellow that an excavation is required. So when Mary went out, this is what she had found in this one. And then also here you can see this is the existing tank on that one. So again, it was a repair of a system that had malfunctioned. So what we did here, this was the screenshot of the email sent to Jack. That is the contractor that is here today. That's in question regarding the March 8th NOV. So you can see that he was issued this NOV actually on March 10th. The letter was written March 8th. And then again, we had the same issue come up then in October, where the open hole was not called in for inspection. And again, it's on the permit there. Our inspector was out. They did go out and they see this. However, in the files, I do have that he did provide us a picture of the open hole, but I did not have any notes stating that that was approved by the inspector, that to go ahead and send us a photo and then proceed with the installation. And then that last one, this is one showing for permit 21-133431. The screenshot of the database here showed that the permit was issued and approved on October 26, 2021. It was entered in by Jill Christensen on that date. You can see that there when she entered that in. However, the request for the inspection to the inspection line for that inspection was received here by Todd Companies on October 25th, 2021. So for that, for those two violations, one being the repeat ones after we had sent an NOV, we went ahead and issued a second notice of violation. That one was dated November 23rd, and that one was sent December 7th. So that is pretty much the evidence of our case of the violations of the regulations. And so at this time, willing to take any questions the board would have.
Any questions for Mitch?
Thanks, Lane. I have just a couple. Mitch, in considering that these were at least 3 consistent or exact violations, can you tell me what education or review of this was reinforced with this individual to make certain that there was an understanding of these requirements?
I do, and actually, there is an email. I do have at least one from Mary to the contractor that states these were some of the deficiencies that were noted when we did the inspection. Trying to pull it up here, but my Outlook, apparently I'm fighting my kids for bandwidth, internet bandwidth here. So Mary the inspector did send an email. That is typically our operating procedure, is after we do have something like this, that we do inform the contractor what needs to happen. The email that Mary did send did say that he cannot proceed without having called in an open hole. So we did have that, and then we did have the NOV as well.
And at the time of the phone call, was there discussion as to why these 3 things were missed? Was there information provided to you as to what was going on?
Sorry, it was an email from Mary to Jack, and
okay.
all I have was just the email that shows that she had informed him that he needs to call in for that.
Okay, so to date, we don't have any information on why this was consistently happening.
I do not know, and
Okay.
I understand after this we'll allow Jack to speak. So,
Okay.
yeah.
Thank you, and thank you also for giving us the overview prior to going through this. It has really helped. Thanks.
Certainly, thank you.
Any other questions for Mitch?
If I can chime in, sorry, I'm Ben Ravnsborg. I'm at the county attorney's office, and I worked with Mitch on this. I just wanted to, just for clarity of the record, make clear that the notice that was sent on November 23rd, 2021, with the most recent 2 violations, also included the notice of this hearing per the regulation that Mitch cited earlier regarding the 10 days notice before any hearings. I just wanted to make sure that was clarified. I think the board has those materials, but just in case, I wanted to make sure that was out there.
Thanks, Ben. All right. At this time, I think we will want to take testimony. I don't have a script to read, but we will want to swear in anyone giving testimony. Mitch, is there anyone that you're planning to have give testimony, or are we just hearing from the contractor?
I do not have any further persons to give testimony, no.
Okay. And Lindsay, if you can help, if we can elevate the contractor so that they can give testimony.
Can you hear me now?
Yes, thanks, Mr. Todd.
Yeah.
Mr. Todd, can you please swear that the testimony you're going to give is the truth?
Absolutely.
Can you please say that?
I swear everything that I'm going to say is nothing but the truth.
Great. Thank you so much. Do you have anyone else that's going to be giving testimony, or is it just yourself?
Just myself.
Okay. Great. Well, we'll turn it over to you. Please share your testimony with the board.
Okay. Thank you. I appreciate the opportunity to respond. I'll first just say that my company has been installing systems for 77 years. My father started the business before there were any health departments. And I personally have been doing it for 54 years. And I know what the regulations are. Actually, my dad was asked to help create the original regulations that CDPHE used for forever. As you guys probably know, the biggest changes to those regulations have happened just in very recent years. So one of the things that I wanted to make you guys aware of, and maybe you already are, the rules, the way they are now, it hasn't always been what it is right now. And I'll also say, because I've been here since 4 o'clock, so I got to listen to all the things on COVID too, which I really appreciated. And I appreciated that some of the board members had said, why don't we look around at what, the other Board of Healths are, decisions they're making and so forth. I think that's valid. And in fact, I want to kind of use that same argument or presentation about the counties surrounding Jefferson County. I'll bring that up in a few minutes here. But first, I just want to say that it's only been in very recent years that an open excavation inspection has been required. For most of my years working in Jefferson County, and by the way, our certification number for the pumping business is #1 in Jefferson County. We were the first. We were there before you guys were, and it was true with the installation as well. Although we let that lapse for some years, we got out of the install. We have made literally thousands of the septic tanks that are in Jefferson County. We were the major manufacturer of concrete septic tanks for decades. So anyway, you didn't used to require open excavation inspections. And another thing that has changed is the permits. For a lot of years, we were required to make 2 sets of copies of our proposals, and had to have wet signatures on them. And we'd bring them in and pay the check in the office there for them. So a few years back that changed, and we were allowed to do electronic copies, and we were allowed to use credit cards or debit cards for paying for the permits. I felt like that was an enormous step forward. We used to get approvals online as well. Just like Mitch said, you'd go out, you'd have in hand our design, our engineering, our proposal, And you would look at the site, you'd do reconnaissance, you'd see where the wells were, where the utilities were, the lay of the land, and all of that. And then we would get an approval, a permit online. We continue to get what looks exactly like that. One of the addresses that Mitch brought up was this one in Willowbrook subdivision, the 5701 Crestbrook Drive. I'll just read you what I received in the mail, on email. This was September 22nd, 2021. And it says address 5701 Crestbrook Drive, permit number 21-130088OW. And then it gives the engineer of record and so forth. And it says, and I quote, "Your application for an on-site wastewater treatment system has been approved and permitted." And then it says, if you have any questions, contact so-and-so. We still get these. However, what has changed is when we get these and we read this, and here's the permit number, and your engineering has been approved and permitted, it's not true, apparently. I have never gone out there and installed anything that we didn't already get a statement just like this saying the engineering has been approved and permitted, and even a permit number. But what started happening is we would get sometimes 2 weeks later in the mail, in the snail mail, we would get this typed up. It's all the engineering, and we gave to you. We get it back, and it'll say contractor's copy, and we can go out and do the install. So it has become very confusing, and it is very time consuming. A lot of times these engineering, I've got several of them on my desk here. I counted the number of pages that are printed up, and it's 25, 30, 33 pages that I created, I electronically gave to you. And I'm gonna tell you, when I got this one on the 5701 Crestbrook Drive, I have Mary Sloan's writing on here, has a stamp, a green stamp that says Jefferson County Public Health, OW2TS design approval by, and it's got Mary Sloan's signature, and it has the date, September 14th, 2021. So she had been out there, did the reconnaissance, looked over all the engineering, approved it all, stamped it, signed off on it, and dated it. And then the one that I just read to you a minute ago, which said that my engineering had been approved and permitted, is dated September 22nd. So that is 8 days later. But that's not when I got it. That's when it got printed, and then it got snail mailed to me. So it was days later after that. So we got a process here that is wasting a lot of trees, because I'm not going to keep, 20 to 30 pages of typed up material that I already have in the computer saved because I sent it to you. So this is just incredibly time absorbing and wasteful. The paper, the ink, the stamps, the envelopes, the mailing, the time, before I can actually start the work. So here's the part I would like to explain about. You know, the majority of our work isn't in Jefferson County. The majority of our work is in the Tri-County area. We also do work in Elbert County. We do work in Broomfield County, in Weld County. None of these other counties send us paperwork like this. One of the things that's in that paperwork is a very heavy paper, which is an inspector's sign-off sheet. Jefferson County is the only county we work in that puts that in there and says you have to post this on site for our inspector to sign. And that's a violation if you don't post that in a visible area and protect it from the weather and the wind and whatnot, so it doesn't get wet, doesn't blow away. They have to sign off on that for you to move on to your next phase of your construction. None of the other counties do that. And we have been called on the carpet for not having this inspector sheet, this sign-off sheet out on the job. But over and over and over again, we put them in it's a plastic protective layer, and we put weight on top of it. We put it right on top of the lid of the tank, usually of the new tank. And here's what, there's some really bad things about, just a sec, I got a call that was coming through. Okay, there we go. It's a bad deal when you have a system that's all ready to backfill and you got weather coming in, or you have a weekend and you're trying to get things backfilled and no one calls you and tells you, hey, I was just at your site, looks good. No. And this is no joke. Sometimes we've had on Fridays, inspections called in. This was when you're still doing Fridays, right? It happens on Thursdays now. The inspector actually will come there that day, but we never know that they did. And we never find out till the next week. The next Monday, we find out, oh, they were there. So it's a bad deal relying on, the other thing is, we can't tell from our other jobs or from our office or from our shop. We have to drive out there and look on that card. But over and over and over again, they don't even stop and take the time to sign them or make any comment. So we go to all the work and trouble to put this thing out on the site. We've even sent people out, at 5 o'clock, 5:30, 6 o'clock at night to find out, okay, are we backfilling Saturday? Or are we backfilling tomorrow? But we can't because no one signed it. And then we find out on Monday, oh, they were there. I do love that, and your inspectors are really becoming great at this. They go back, get on their computer, and they email us and tell us, this is what we found. We saw the new tank, we saw the STA, it's all approved, good to backfill. I like that. but even that takes a lot of time. In the other counties, all of the inspectors have cell phones, and all they do is they just get on there and say, Jack, good to go, or good to backfill. You got a green tag. It takes a second, but it changes life for everybody working in the field end of it. So I don't think that we should be in trouble for not putting these inspector sign-off sheets out there when the inspectors themselves don't always use them. The other thing, none of the other counties that we work in, do they require an open hole, an open excavation inspection. Jefferson County is the only one. And so we, in the process of doing the work, we are so used to, like I said, we do more in other counties than Jefferson County. And we will dig a brand new STA, and we have the components on site, and we put them in just like we do everywhere, except in Jefferson County. So since I got this letter from Mitch about the hearing, I think he will verify that we have not messed up once. Every single time we've had a letter, an inspector sign-off sheet on site. They don't always get signed, and we have not started a job, even though we get these emails just like every other county. And in every other county, we get an email say, here's your permit number, and boom, we go. In all the years that I've been doing this last summer was the biggest backlog we've ever had in the history of our company. I've never seen anything like it. And people were all over us trying to get us, you know how it is. People are selling their homes. They're trying to get use permits, but they can't until they get repairs done and so forth. We are just getting hammered. And here we wait up to 2 weeks after the inspector who did the reconnaissance signed off on it. We're just waiting and waiting and waiting for something to show up in the mail. So I don't deny that this has happened. It's happened, I think, for two reasons. One is you've changed policy. You used to do it the way the other counties do it. Now you don't. And secondly, the other counties are still doing it that way. And so we are so in the habit of doing it the way that we've always done. I highly encourage you guys, highly encourage you to change some of what you're doing and do it in a way more efficient fashion that will save a ton of time. And you won't, man, it would take the load off of your people in the environmental health office having to type all this stuff up and snail mail it out. There's a better way to do it now. And you know what? We also get the homeowner's copy. And so we can hand that off to the homeowner. But you know what? The homeowner doesn't want it. Nobody has these filing cabinets anymore with all this paper in them. They want it electronically. So we're creating all this time. We're creating all this expense, and very inefficient in time to create stuff that just gets thrown in the wastebasket. So those are my proposals. Even in the other counties, even when we're doing over excavating with 2 or 3 feet of sand put into the bed, and then either gravel or chambers for the other components, even then we don't have to do an open hole inspection. When Jefferson County first started doing the open hole inspections, it was only on the over excavated beds. And then all of a sudden, we were told, no, you have to have an open excavation inspection on every bed, even if it's not over excavated, even if you're not hauling in material to put in there. So I just think that the whole permitting process, man, from the start to the inspections to the end, someone should go talk to Warren Brown or somebody from somebody currently, Keith Hammersham over at Tri-County, and talk to them about how they're doing things. They do half as many inspections, and a lot of times, most of the time, we get a permit from the time we go out and do our test holes to the time we have the permit in hand that we print off our computer in our office in a week. And we were told, I know Linda Jones, I'm so sorry to lose Linda Jones.
Jack,
Yeah.
sorry to interrupt you for a second. I want to bring us back to the hearing. I really appreciate all the insight you're sharing, and I really encourage you to continue to work with staff on how to make the program more efficient. But I want to just bring us back to the specific components that were needed in the regulation. So just want to make sure I summarize what I heard from you is that one of the challenges is that you're working across multiple jurisdictions, and so potentially that the regulations are not all identical. But again, to work in Jefferson County, you do need to follow the Jefferson County rules, even if they may be different. I'm not so certain that other jurisdictions don't require a test pit to look at. But again, specifically in Jefferson County, that is required. So, and then the sheets, I don't think is the component of this nature of our hearing. I know you had mentioned that several times. And again, I encourage staff to continue to look at the program and how they can make it more efficient. But I think the specific reason we are here is that those inspections were never requested as per the regulations requirement, and that work proceeded without having those done. So that's really the nature of what we have. You did mention that one permit that was shared that you had an electronic approval. So if you can share that certainly I think will be part of the record we can consider. But the other things that were repeated were, again, that those final inspections were requested, but the open hole inspection that was required before that had never been requested. So again, skipping that step, because again, as you mentioned, it wasn't as familiar to you guys. I know that's been a requirement. We passed the last version of this in 2018. So it's been over 4 years that we've had that requirement in Jefferson County, and it may have been even longer than that in the version before that. But anyway, again, that has been in the rules for a number of years, definitely during this time period. And I think I heard you say that you had been doing this so long, and that was a change that just wasn't one that was as familiar to you. Is that accurate?
I would like to make some clarifications. Yeah, in the in the major scheme of things, the last 4 years, I had 50 years of doing it a different way before that. The other thing, there's a distinction between the soil test pits and open excavation inspection. Those are two completely different things. we have not failed to do any of those soil test pits. The open excavation is the STA. They want to see the STA excavated, which would be your entire leaching area, your soil treatment area. That we don't do anywhere else in any other county. So yes, and I agree, and I'm telling you too that I agree that we have to follow the Jefferson County rules while in Jefferson County. Absolutely agree. I'm hoping through this hearing that perhaps some of the things that have been antiquated could be changed. But like I said, since Mitch informed me we were going to have this meeting, we have not messed up anywhere on anything, and we're not going to. I also wanted to clarify that I read you the one letter, the email that we got, but we get those every time on every job. We get an email that says your design has been approved and permitted, and here is your permit number, but we can't. It's just, that should be the end of it. We should be able at that point, okay, what we submitted is approved, we can go out and build it, but we can't. That happens on every single job, and sometimes it takes up to 2 weeks. And I just wanted to tell you too that, you know, to get the inspection or to get permits in Jefferson County had been taking longer and longer. And we were telling people, hey, expect 4 weeks, to get a permit. And then
Oh dear, I think we might have lost him. Does anybody else hear him?
No.
I'm not seeing him in the participant list.
Thanks, Kelsey.
Looked like he was having problems with the service, and it looks like he dropped.
So I would propose giving him a couple minutes to try and reconnect, and then I might move into the questioning phase of this hearing. So you're welcome to close general testimony unless there's someone from the public who would wish to speak on this. And then after that, I would just direct your questions to Mitch, the AHS team, and Mr. Todd, so that you can get any outstanding issues resolved before you decide to take a vote on the matter.
Do we have anybody from JCPH who's trying to, or the attorneys trying to reach back out to him to see if they can get a hold of him?
I'll work on it.
Thanks, Mitch. John, do you have a comment?
Yes, I just called Jack Todd on his cell phone, and he lost connection. He's trying to get back in.
Thank you.
Uh-huh.
I think I'm back. Do you hear me? Okay. So I guess I'm just going to let you guys ask any questions, and I'll answer any way I can.
Thanks, Jack. Any questions from the board? Kimberly?
Yeah, I have one or two. Mr. Todd, first of all, thank you for your time this evening and giving us kind of a historical perspective. My question for you is, between 2018, when the new on-site wastewater regulations were updated, and last September, approximately how many open excavation inspections were completed by your company on work you did in Jefferson County?
Oh,
an
man.
estimate, just an
Okay.
estimate.
A guesstimate.
Mm-hmm.
I would say, probably 100.
Okay. And so of consistently having those inspections completed, what then led to the discrepancy of these 3 in September? I believe it was in September of last year, where now they weren't. Why weren't those falling kind of in those 100 approximately that you shared with me?
Sure, thanks. What changed so much was just the workload. It was crazy. So in the past, we'd get a permit and we'd be working on other jobs and so forth, and it just worked out timing wise that we would never get started on a new job before all the paperwork came in the mail. And then as we were trying to catch up and trying to take care of customers, we got better. You know, we got more efficient at what we did, and we were moving faster on them. And I think that's why we ended up out on jobs, you know, before the paperwork even made it to us.
Thank you.
And that probably also just the sheer number of jobs that we were doing. It was easier to miss a step or miss a call for an inspection, especially when it was a call that we didn't have to make in any other county. You know, it got hectic.
Thank you.
Sure.
Any other questions from the board?
I have one, and
Sure.
I'm just trying to get something clear. You quoted 3 times this notice that you get. One time you said your application has been approved and permitted. Another time you said your engineering has been approved and permitted. And the third time you said your design has been approved and permitted. And I'm just trying to figure out whether maybe what was that notice about? Was it just about your design, or was it about the engineering design, or was it about the whole application process being finalized?
That is a great question. It all comes together in that application. The application is a part of our reconnaissance from the site, our design, our engineering, our math on all the numbers. There's a lot of math that goes into these systems today, especially when they're pressure dosed and have pumps and control panels and high water alarms and so forth. So yes, it's the application, which includes all of the design, all of the engineering, and the actual words that come out on this email says, your application for an on-site wastewater treatment system has been approved and permitted. So it's the application which involves all of those things you were questioning. Did I answer that well enough? Okay.
Any other questions for Mr. Todd or for staff?
I just want to say that I really appreciate so many of the really great people that you had over there. I worked with Craig Sanders for decades, with Linda Jones. It's been a while now. I've been working with Mitch and John Vickery, and I really do enjoy working with all of them. And I feel like they really try to do a great job to a person, every one of them. And we want to do a great job as well. And if we can work together to do things more efficiently so that people aren't so much under the gun and always behind, that I would be all about working with your people and kicking ideas around, and maybe even trying a pilot program or anything. So I just thank you all for hearing me out.
Thank you. Kimberly, go ahead.
I just have one final question.
Sure.
Understanding the answer to the question that I previously asked, where you said that it just got so hectic that it was easy to overlook. Can you share with me what processes you have put in place now? Because the regulation's not going to change, at least not that I am aware of right now. This will continue to be required, and anywhere you look in Jefferson County, building is continuing at a very fast clip. So what have you put in place to avoid this situation that brought this before the board tonight?
Well, we have a book it's actually like a 3-ring binder that I punch and put all the paperwork that comes from Jefferson County into, and we have a checklist. We created a checklist of that's actually a sequence of what things have to happen in order to not miss anything. So that's why we haven't missed anything in a while here, and going forward too. Thank you.
Any other questions? I have a question for Mitch. Is that pretty rough? You know, Mr. Todd was just trying to, off the top of his head, give an estimate of how many permits in, last several years. Is that a rough assessment of about how many permits this contractor has done in Jeffco?
We do about 200, and I think our numbers were about 260 new construction, about 60 repairs, and I think about 60 additions or component inspections. So we're looking at roughly, what is that, 120 plus 260 would be about almost 400, 500. So I'll be honest, it's a little bit high, but I think what we're asking there is permits, and that was a little bit different, because then there's inspections, and in each permit can have multiple inspections. And so I was trying to look that up to go back through our database to find how many inspections that we've had with Todd's company's name on that. Like I said, I'm fighting my kids for bandwidth here, but so unfortunately, I can't give you that number right now. But I will say, to what Jack had mentioned, I have not heard of any further complaints from the staff that inspections have not been calling in. So I was trying to go back and see how many inspections that he might have, or projects that he'd been working on since that NOV has been issued.
So just to make sure you can point us to, I've got the Jeffco regulations open, Mitch. The inspection that was missing, it wasn't an open hole. This was it was the STA open hole inspection. Is that what it's called?
Correct. Yes, the open excavation was the 3 instances that was missing. That 4th one that Jack had talked about out of that one property, that was a different violation under the regulations. But the one that with the open holes, what we had cited that for was performing all work in compliance with the regulations and the conditions specified on the permit. And so as I was showing on the permit, it does state that inspections required open excavation. And actually, I do have a permit. I tried to go back as far as I could on the time that I had, but I have a permit here from October 18, 2006, and that open excavation requirement that's on that permit as well. So that has been something that we have had required for as long as I've been doing this.
And that's spelled out on the permit. Is it spelled out in the regulations as one of the inspections? I'm just looking at all the components.
It is not specifically under the inspection as an open hole is required in the regulations.
So this is just during the installation of OWTS, all system components shall be inspected and approved prior to backfilling. Is that kind of where that falls then?
Correct.
Okay.
Yeah, that would fall there as well. And again, we do that. Yes, Tri-County does not do the open hole excavations, but our argument for why we do those in Jefferson County goes back to the presentation we just saw previously. The geology that we have, that fractured rock environment, the fact that we don't have a lot of soil is one that we would like to go out and do the open holes to make sure that we're seeing the area where the treatment is going to be.
No, and that systems are installed so that they're level and you're getting good distribution. I mean, there's value in that. All right. At this time, I think we'll close testimony. Board members, any additional discussion?
I have a question.
Go ahead, Sherry.
I just have a question. Because the document that I have has said that there's the choice to be, well, the board may revoke or suspend a system contractor's license. Is there ever a probationary period or kind of a notice, okay, this has happened, if it happens again, does it have to be such a either revoke or suspend?
I think we can have Kelsey join us. I think there's also a provision for issuing fines for violations of the regulations. So I don't think it's just limited to revoking or suspending.
That's correct. So the regulations are a bit vague here. We definitely know that you have the power to either revoke or suspend a license. I think you certainly could take an action that essentially says we're keeping an eye on you. If this happens again, we will haul you back in here for another hearing, at which point we have the right to revoke or suspend. If you do find a violation of one of those specific enumerated sections of the regulations, you could issue a fine for that. So those are really your options here. Or to do nothing, that's also an option.
Additional thoughts from the board?
I just think that due to the fact that there's been so many jobs that they have performed very well and that there haven't been any other incidents, they have a process in place. I thought that was a great question. Kimberly, what have you done that so we can make sure that this isn't going to happen again? And I think that those things are all very important as we make this decision, that there's some kind of notice that, you know what, this can't happen again. I'd hate for us when they really have been a good steward, a good company, that we make it real punitive. I would hope that we wouldn't do that.
If I may, just for clarification, JCPH staff did issue 2 notice of violation letters to this contractor. A notice of violation letter is supposed to be that, hey, we're seeing a problem here. We need you to clean it up. If not, you know, then we'll have to go to the board. This contractor was issued not 1, but 2 notice of violation letters before staff brought this to your attention tonight.
Additional thoughts?
And if I may, Lane, I've got internet back. For 2021, I have about 15 permits that Jack's name is on.
So this was, again, I think the question was since the regs changed. So again, since 2018, so in the last 4 years.
Oh, since the last 4 years, that'll take a little more time because it's
Okay.
listed with use permit inspections. But
So even if we multiply that by 4, it's ballpark, not too, it's a lot more than 2 or 3 installations, I guess, is the point. Is it's
yes.
This was not the only three jobs that he had in the county. I also don't feel we want to be overly punitive. I do feel like, you know, getting busy and work doesn't excuse the, you know, of needing to still follow the regulations. I don't feel it's so egregious we should revoke a license personally. I think a penalty might be more appropriate because again, I don't think it should be nothing. There was a warning issued formally by the department and then another one that led to our hearing. But I don't feel a full revocation is warranted here. I think that 54 years of doing business in Jefferson County and, you know, certainly having mistakes here in the last year doesn't necessarily warrant revoking someone's license.
I agree, Lane. I'm appreciative of the work that you have done in this field and your family have done in this field in 75 years. That being said, as we have started seeing a huge increase in building, if you were on the call earlier this evening, you heard part of some of the issues that this county is facing in terms of risks to the safety of our citizens in the ways that we deal with on-site water systems. And so to that end, I want assurance that we're operating in today's environment. I can appreciate the past. I can appreciate that other counties, for whatever reason, do not have the same regulations for your particular company. And perhaps further discussion between you and Mitch can help you better understand why our regulations are what they are. But I agree. I think that I would rather look at a penalty rather than a revocation or a suspension.
Thank you.
From my reading of the regulations, if we find that the person is in violation, the board may assess a penalty of up to $50 for each day of violation. I don't know exactly, other than the 3 instances, if those are 3 days versus there's any other additional days that these violations occur. So for that, it seems that would set $150 fine. It's not a very steep fine, but it seems what we have 3 days of violations that have occurred. I guess I'll make that motion of a $150 penalty, but no revocation or of license.
If that was the motion, I would second it.
Can we get a confirmation from either Mitch or John or whoever that it was 3 days? I got confused with that one slide of this was approved or partially approved or whatever.
Yeah.
So I would just like confirmation of how many days we need to apply this fine to. Thank you.
So the dates that I have for the notices of violation for when we were called out for inspections on these, I have one for March 8th, one for November 24th, one for October 26th, actually 2 for October 26th. So that would, 3 days total.
And I think it seemed like there was maybe a mix of information that Mr. Todd indicated, and I would still want to see that other instance about not receiving a permit, but he seemed to at least receive an electronic approval that he read to us. But again, it sounds like that was the same day for the other issue. So I don't know that we would count that as separate days. But anyway, that still sounds like we're at about 3 days. Not a very significant penalty, but again, it doesn't feel like it warrants to just ignore this either, because I appreciate being busy. That's actually a good thing when the economy is rough, that you have good business. But again, I think we still do need people to follow the regulations. I also would encourage staff to speak with Mr. Todd. He had a lot of ideas on ways to look at revamping how things are done. I think to get more information back and forth between the contractors and the work that staff are doing, so that they're not as reliant on driving out to a site to find out if an inspection occurred. Those seem like some reasonable things to consider. But anyway, so we have a motion, any additional discussion?
Yes.
Harriet, go ahead.
So can I suggest a friendly, hopefully friendly amendment that if there are any more violations, we not wait for 3 or 4 more, but that it come back to us after a single violation?
Yeah, I think that's sort of a future state versus a present state. So I think if there's issue in the future, or certainly that could warrant another hearing. So. Any additional discussion? All right, we'll call for a vote. All those in favor, say aye.
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 Any opposed? Any abstentions? Mr. Todd, thank you for your time. Thanks for your service for many years. Unfortunate that we're meeting with you as a board for these reasons, but we appreciate that you will follow the rules very closely, as it sounds like you have since you've had this last notice. But thank you for your time tonight.
Thank you. Appreciate you.
All right. We have a whole lot more on this agenda. Let's see. Next is Board of Health direction for variance case hearings. And I think Kelsey is leading that.
I am. Lindsay, would you please pull up the PowerPoint? Well, thank you so much. This is another short PowerPoint. So at the last Board of Health hearing, you all had expressed a little bit of frustration with the variance process, and we're hoping to maybe find a way to either limit the number of cases or to make it a bit more efficient. So I am going to give you a quick statement of the law, and then I'll have Jim kind of hop on and help me at the end to discuss some of the options. So real quick, you have a couple of different sources of law for your variance cases. The statute generally states that boards of health are allowed to adopt variance procedures if they choose to. Regulation 43, also coming from the state, says that if you choose to allow variances, you have to follow either the procedures that are set forth in that regulation or have stricter regulations. Jefferson County did somewhat of a hybrid. It largely adopted the variance procedures, but it does have some additional stricter requirements, such as our lot size standards. Next slide, please. So again, going back to 43, you may adopt a variance procedure, but you're not required to. So it really is at the board's pleasure whether they want to have regulations that even allow variances in the first place. Next slide, please. For our regulations, pretty simple. You do not allow any sort of variances from the Regulation 43 requirements. These are usually around treatment levels, setbacks, a few other things. What we do typically see are variances from our own requirements, which are typically lot size. You also have some variances that do not require a public hearing, which I was interested to find. And those usually concern minimum setback requirements for the repair of existing systems. I will say when I was reading through the regulations, this was not terribly clear. So if you do consider an update to these, I would like to just clarify how this is drafted so that any regular person can read this and understand what it's saying. Next slide, please. If you have someone who would like to make a variance request, there are certain requirements that they have to follow. They have to have the exact regulation that they're requesting relief from. They need the technical justification from an engineer. They need to discuss alternatives that they've considered and show that scientifically the variance is really the only way that they can do this, and that it wouldn't pose a risk to the public health and environment. And finally, they need a statement of hardship. Next slide, please. You should all be very well familiar with this. We have 8 criteria to grant a variance. Most of these come from Regulation 43, but the top 2 are ones that are set out in our own regulations. And those are, of course, that the variance would prevent a substantial hardship to the applicant and that the variance would not be injurious to the public health, water quality, or environment. We'll talk about these a little bit later. Next slide, please. Finally, the applicant really is bearing that burden of proof. They have to prove every element of a variance. And if they can't provide you evidence that all of these criteria are met in the prior slide, then you need to deny that variance. I also did find that the applicant is supposed to bear the cost for recording any variance granted on the title to the property, but EHS staff was very helpful in letting me know that we could do it for free, so we've been doing that as a courtesy. Next slide. So how do we get to modifying variances? There's a few different ways to do that. So kind of tying into Jim's presentation from earlier, you could modify table 4-1. So instead of having your minimum lot size requirements for development, you could have a system, for example, where you tied treatment level to lot size. So you could even say, if you have 2 acres or less, you need a 3 TLN. If it's more than 3, you need 2, etc. That's an option. You could utilize the nitrogen loading model that Roy discussed earlier, but as I understand it, that might take quite a bit more data than what we have to apply to the entire county. Or smaller, more immediate fixes, you could tighten up your variance process. So for example, hardship is not defined in the statutes, regulations, and I could not find any case law on it. So something that you could do is take the approach of a board of adjustment, for example, which is probably the closest analog that we have for variances. And instead of saying any hardship in the world that's not financial will get you a variance, you could say we will grant variances that are linked to the physical condition of the property itself, excluding lot size. So you could say, we're willing to work with you on setbacks if you have a bunch of rock outcroppings or you are on a cliff and technically your property line extends out so you couldn't meet them. So that's something to consider. And then another option would be to define you're not injurious to the public health, water quality, or environment. That seems to be a very ill-defined standard. I think it might be helpful for staff to take a crack at that so that you guys have a better idea of what proposals would really fit in that criteria. So that is sort of like the super top level quick presentation of what you could do to help with this variance process. I don't know if Jim, you had anything that you wanted to add?
No, I think you did, excuse me, you did a fine job of explaining the requirements. I guess what I'm, we're very interested in trying to come up with some solutions for the board. And so it'd be helpful for me to understand what exactly, or even thoughts of what you would like to see modified or adjusted in some way so that we could begin to work toward doing the necessary research to see if that's something that we can do. If you want to get away from variances altogether, or if you want to have some stricter limitations on what variances may be granted for, I'm open to ideas. I really don't know. Just to clarify one statement, in fact, maybe I misunderstood you, Kelsey, but Reg 43, JCPH regs really limit variances to anything that's more stringent than Reg 43. So all of the provisions of Reg 43, which is a state regulation that we have adopted in Jefferson County, those cannot be varied. And so it uses in the regulations examples of certain setbacks that are more stringent, like the 200-foot well setback, well to STA, or the minimum lot size, because that's more stringent than the state's regulation. But there aren't really that many more things that are much more stringent that I'm aware of, I could be wrong, that are more stringent than the state. So if there are things that have kind of bothered you, I think Kelsey covered it. Some of them in particular as in terms of need of greater definition, such as hardship. And there may be some examples we could find out in the world that might help us define that. And then the whole, harm to the environment and public health, I think that definitely needs to be cleared up. And I think that there's also opportunity coming in the next year or so, maybe 2 years, with the state health department doing a revision of regulation 43 to perhaps we could even work with them over the coming years, maybe to create the definition so that it becomes clearer for us and for the state. So if there's any ideas you have or thoughts, I'm very open to doing what we need to do to help with this issue.
Thoughts from the board? I think for me, it's been very clear. It's table 4.1. So, and that really has been, I don't think I've heard a variance that wasn't related to lot size. So that has been the central issue. And so I think, again, modeling the work from Indian Hills and changing our regulations to have, appropriate treatment for appropriate, locations in the county. And then ideally, we don't need variances anymore. So to me, the regulation changes is what I think is what we probably need to do. And then certainly I would be very much considering removal of our variance provisions then, so that would really address it, I think, is if we've cleaned up our rules that we don't need to have this anymore, and we've spelled out this is the treatment criteria for the type of system that you're trying to put in the lot that you have, and I guess be done with that. And it sounds like, I think Kelsey already mentioned that existing systems that have failed that now need to be repaired is treated differently. You're not suddenly subject to more acreage than you even have on your lot. So again, that feels like we're not trying to take property then at that point. So,
and I think I'll clarify that a little bit, as I saw a response from Craig Sanders this afternoon, that a variance would still be required if there's a setback issue for offsite physical features. So if somebody's well, a neighboring well was not able to be kept 100 or 200 feet away, then the board would have to hear that. If it's an on-site physical feature, as long as the proposed repair meets or exceeds the existing conditions, we can issue those permits administratively. We don't need to go to a hearing for those. And we always push for maximizing setbacks anyways. So I don't think we've had too many. The engineers are pretty good about really addressing offsite features and really having no impact on the neighbors from a setback perspective. But that often in some of these areas, on some of these smaller lots, can result in, a new leach field or tank or something being closer to a well than would be allowed by our rules. And our rules say that they cannot be any closer than the existing conditions. So if that means they've got to excavate the existing system and put in a new one right in the same location, and that's the only place to do it, that's what we would be allowed to grant permits for administratively.
Thanks, Jim.
Mm-hmm.
Any other thoughts or direction from the board?
Anytime any of you would have any thoughts on this, feel free to reach out to me. I think we've gotten some good direction here, though. I think we really need to be really exploring our options on table 4.1. I think you're right, Lane. If we can get away from minimum lot size based on age or date of platting, that could solve a great deal of these cases or really reduce them tremendously. So we'll start working on that.
Thank you.
So I think the question is this board leaning towards the nitrogen loading model, or are they leaning more towards the treatment level being tied to lot size?
From what I understand after today's presentation by Roy, the nitrogen loading model is going to take us years. We need more data, we need more evidence to really stand firmly in making decisions on that model. So that being said, my, I guess, choice would be to work at applying table 4.1 consistently, and then to also clarify those sort of nebulous terms of hardship or the other one about what constitutes a risk. Those three things, I think, bring us significantly closer to having consistency. And that's what I think we really need to be working towards while we wait for the math and the evidence to happen. It's my choice.
I think I don't know that they're completely separate. I think the work that what we approve for Indian Hills is based on, again, the nitrogen loading model that's already been developed. So again, it was, the table that now is going in for that area upslope is based on a summary of what that model is creating. So you're saying, here's how many acres you need for this type of treatment. And that comes from the model. So I don't know that they're separate issues. To me, that they're connected. So to me, it very much needs to be science driven versus just arbitrary. Again, you can find lots of arbitrary, very even numbers that have been picked all across the country and state of how many acres are needed when that's been chosen as the model for, again, a little bit more land use control rather than specific public health science for on-site wastewater. So to me, it does need to be driven in what is the carrying capacity, and it isn't probably as simple as just acreage. I think the type of soil is very, very critical. Getting through 4 feet of soil into the aquifer is really where we're focused. We're looking at acres and acres of land and 200 feet to where a well is, but if it's 4 feet and you're in the groundwater, that's where we need to make the treatment. It doesn't matter that the wellhead's 200 feet away. You're still pulling that same water that was contaminated if it wasn't treated in 4 feet. So that to me is the science of it, is what do we need to really treat this? And then obviously not have a density that's allowing this accumulation of the waste, because we're not removing all the waste with any of the systems.
Right. I think this opens the door to us applying not only for vacant land, but also moving towards what we did with the Section B in the Indian Hills policy for replacement systems and in improving the treatment levels for replacement systems to keep things fair for all, for all intents and purposes. What if we're going to require somebody with 0.8 of an acre to have a TL3N and in order to build on 0.8 of an acre, then when the person with 0.8 of an acre that has a failing system go in, they should have to put in a TL3N. That's my perspective.
I agree. I think that effort to go back and fix, years and years of when the rules and science was not applied is still at some level important to do. And certainly at the time of a sale, now when people are going to recognize the value of their property, making sure that on-site wastewater system is as good as we can get it makes sense, versus just allowing a legacy system to still persist just because it hasn't bubbled up to the surface.
Great.
All right, so my next question then is this something that you would feel comfortable voting on as a regulation change at the next meeting? Or is it something where you would like a proposal at the February meeting for a potential direction to put it in the newspaper for a vote at a future meeting?
But I don't remember the exact process. I know Jim ran through this for us. Do we, as a board, approve the rules, but then it goes to the state for approval? Is that kind of the process? But I think we still need some public input process to make regulation change.
Yeah, that's a great question. So basically, we have to put this in the newspaper for 20 days before your hearing. Then you'd need to have the full hearing with the board and public comment. And if you approve it on that day, then it needs to go to CDPHE. And if they don't say anything for 45 days or they say we're good, then the regulation is in effect. If you have further changes you want to make, you can certainly bring it back, and you are not required to do public comment after that first period.
I mean, I know that we don't want to burden staff with regulation change after regulation change, but table 4.1 to me rises to the point where we need to fix that. And certainly other changes that I know you had a bunch in the hopper, it sounded like, prior to COVID, that you were wanting to make. So to me, a reasonable amount of time, to get the changes that are already ready to go, but that we can fix this big issue in our regs. And then if there's additional work with the state at a larger level, that's great too, but I don't really want to wait 2 years to fix table 4.1. I think that's 2 more years of nightmares of variances.
I would respectfully request of the board that we have at minimum 6 months to work through this process with all that's going on at the department, still being in the midst of COVID, loss of staff, turnover. There's all kinds of different issues we're trying to deal with. If your desire is to do the simple approach and just create a draft, post the draft, have a public hearing, make a decision, give it to the state, I think we could do that in potentially 6 months. But if we have to do, or if you'd like us to do extensive public outreach and public input or public comment, there are many, many different stakeholders in the mix that should be involved in this type of a decision-making process, because you're going to have impacts on not only landowners or property owners, homeowners, but we have real estate community, we have installers, engineers, others that play a huge role in implementing these regulations. And I'd hate to implement something that we didn't recognize unintended consequences because we didn't do enough public review. So if I could get at least 6 months to to begin exploring this, maybe putting a proposal together. Be happy to bring a draft or something to the board to see if we're heading in a direction that you'd like us to head, or you think it's appropriate, and then we could move through that public process, as quickly as possible.
That sounds more reasonable to me. How about for the rest of the board? Is that?
I can say, I apologize that we haven't quite met all our deadlines and our projected deadlines on some of the efforts that we've made. But, my hope is that what we can at least do is get moving on some of these individual issues. We don't have to do a total revision of the regs, although it's much easier to just do a full reg review and revision and then let it go for 3 or 4 years than it is to try to open it several times during a 3 or 4 year period. But we can certainly start working in the variance realm and working on the table, the property sizing table, or getting rid of table 4-1 and replacing it with something that makes appropriate sense for this county.
So would it be feasible, Jim, to ask for a draft proposal at the May Board of Health meeting for us to have further discussion on? Or are you asking for 6 months to the proposal? Or 6 months? So I'm trying to figure out, are we looking at 6 months until we have done what all the stuff Kelsey talked about and have your input in? Or are you asking for 6 months to bring the proposal to us? Thanks for the clarification.
This is January. I think by May, we could draft a proposal. Bring that to you to see if we're headed in the right direction. If so, then we can move on advancing the public notification, perhaps doing a hearing a couple of months after that. These days, it's so hard to predict what's going to happen, in 2 months, let alone 6 months. So.
And I do just want to make sure the Board of Health is aware when, Jim is asking for this grace, that a large number of his staff over the last 2 years have assisted with COVID response above and beyond the regular environmental health duties. They've also then had to do all of the regular all the restaurant inspections, all the WTS inspections, all of the swimming pools. They've had their regular workload plus COVID on top of that. We are working really hard to get them staffed up to take off some of that time burden, have hired several people. But as you know, when you first onboard people, even though they're going to pay off in decreasing everybody's time burden down the road, right now they're also training and onboarding those new staff members, which is an additional time burden. So just, I know the Board of Health is anxious to have this done. I know when I sat on the Board of Health, I was anxious to have it done. But the last 2 years of COVID have really, really made it difficult to meet the progress goals that were originally in place. And just like to make sure the Board of Health keeps that in mind as they put forward timeline requests.
All right, Jim, you were muted if there was anything else you wanted to add.
Yeah, no, I think I will bring this back to my staff forthright, and we will begin talking about the particular issues. Kelsey, I'm going to count on you to help me make sure that we have it straight. Bring back a proposal, and it may only be for 1 or 2 things in May, whether it's about variances and or the table 4-1 or both. We'll see what the best we can do in light of the circumstances we're in right now. I hate to overpromise, I'm telling you. All right.
All right, Kelsey, is there anything else, or we wrap that one up?
Nope, I think we have the direction we need, so we should be good to move on.
Perfect.
I guess I want to check in. We still have a significant amount of our agenda left. So are there any items that can be tabled, or are there other things that that are urgent that we need to do. So
I know I could do my update in about 2 minutes. I'm also happy to table it till the next meeting.
I am happy to table my update also.
So Jody's up next, and then Jim, yours is that under number 10?
It would be under directors.
In your leadership team comments?
Leadership team comments, yes.
Okay.
Okay. I'll say the things we have to do under new business are the last 2 bullet points, but those should take no time at all.
Yeah.
The
Update
fire response update, we could table that until next month. We had it on here because it is so topical and timely. We wanted to make sure we gave you an update on that, but that is the Board of Health's choice if you'd like to have that deferred until next month. And the student project with Nikki, the only reason to request that be done today is just because Nikki is no longer employed by JCPH, and she gave of her time today to be able to come and present to you. And she's been waiting for hours now, and I'd hate to have to ask her to give us another night of free time to provide an update to you since she's no longer a JCPH employee.
And is Anna and Jeanette still on as well?
Yes.
I think that we need to hear from both of those individuals. As you said, they've been waiting for hours to do this. So it's your call, but I'm fine.
No, it's our call, so that's why I'm asking. So
I meant it's your call. I was pointing to.
well, Jody, if you're okay, we'll at least save those 2 minutes, and then let's jump to Jeanette's presentation. If she was able to.
Lindsay, can you help make sure that Anjanette can unmute and share her screen?
Yep, she should be all set.
Hello, can you see my screen?
We can see your screen. Anjanette, can you speak up just a little bit? You're coming across very quietly.
Yes. Is that better? Can you hear me better?
A little bit. If you could speak up a little more, that'd be great.
Okay. Up my volume. Hello, everybody. My name is Anjanette Hawkins, and I'm going to present what we did for the fire. So, as you know, this was a very fast-moving event, and the JCPH EPR team monitored the event over the course of the afternoon through various media sources, news channels, local social media, and we'll start with we'll just go through the timeline of our events and actions. So 1628, we contacted Boulder County Public Health EPR coordinator and offered our ESF 8 support. We did receive response from the coordinator that Vista Adventist Hospital had already been fully evacuated and that they were working on additional long-term care facilities that were needing evacuation. And he reported that there was no support needed from Jefferson County Public Health at this time. Vista is part of a Joint Commission accreditation requirement. So they, in the past, have exercised evacuation. And one area of improvement item that was identified for a hospital evacuation in under 2 hours was that they had limited situational awareness. So the hospital saw flames close to their facility and made that decision to evacuate immediately. We are also part of members of the Metro Foothills Healthcare Coalition, and the coalition sent out requests for transportation support through EMS as well as to the different hospitals and to the ancillary care facilities, long-term care facilities. So we were able to see
that process through our email of the different requests and responses for additional support. 17-19, we sent out a standby for the infant and young child feeding and emergencies volunteer group that we host in Jefferson County. We have a team of approximately 30 volunteers that are trained for deployment within our region and state. And we have family feeding kits and shelter bins ready for distribution. They were not deployed for the fire, but currently are deployed for Afghan refugees. And we also offered ESF 8 support to Broomfield Public Health as the fire started to shift south. Uh, 1724, we notified Jeffco Emergency Management that we were on standby and emailed the executive team, other EPR staff members, the infant and young child feeding group, and health communications on situational awareness, what we were hearing from not only that healthcare coalition group, but also from the Jefferson County 911 communications, from various other resources that we receive notifications from. In 1749, we got notified that Good Samaritan Medical Center was beginning evacuations. Our hospital in Jefferson County, Lutheran, received some of those patients, and we did reach out to Lutheran and offered any resource support, which they did not need. 1801, Jeffcom 911 Communications tweeted that there was a pre-evacuation notice issued by Arvada Police for the areas in Jefferson County, directly south of Boulder. And that included, so this right here, the north side, that's Highway 128. This west side is Highway 93. The south side is 82nd. And then I did take, and then right here it is Alkire, and then above Stanley Lake is Sims. So that's the pre-evacuation area notice for our Jefferson County area. So 1819, another email was sent to executive team and the other people for the situational awareness and to letting them know about the Jeffco neighborhoods being placed on pre-evacuation. I spoke with, on 1824, spoke with Dr. Comstock to discuss next steps for our response and got approval to send out our Colorado notification system, also known as CNS. That is the system that we use to send emergency notifications to our staff. We collect information from staff at the beginning of their employment at JCPH, and then we also send that questionnaire out again every January. People, families change and needs change, so we send that out annually to be updated. That was, and then we updated our social media with wildfire resources for anybody looking for those. At 1949, we did send that notification to all JCPH staff by phone and email. So how it works is I did a blast and it calls all the phone numbers and sends an email all at the same time. And you get to choose from options to respond, how you want to respond. I check the results every 30 minutes to assure that staff were safe and no staff reported any JCPH support was needed. We had about a 45% of response rate to that notification. And then at 21:57, I was notified by Broomfield Public Health that, and I notified our EPI team that we had COVID positive Broomfield inmates that had been transferred to the Jeffco jail because they were beginning to evacuate the jail up in Broomfield. So recovery actions, 2022 and beyond. So JCPH Health Communications team has been providing social media and messaging support for Boulder County Public Health. JCPH Office of Vital Records has offered and provided assistance to affected residents in collaborations with our other local public health agency partners. The Colorado notification system, we're going to be using, the plan is to utilize the system more frequently so that our staff get more comfortable with its use. We do a drill quarterly, but the plan is moving forward is to use it more frequently. And then we also will be collaborating with our Metro Foothills Healthcare Coalition to reach more ancillary care facilities within the Broomfield and Jefferson County areas, and look for those agencies and facilities that are not currently members of the coalition and reach out to them to work on emergency plans moving forward. And that's the end of my report. Any questions?
Questions? Board?
I just want to take this opportunity to thank Jeanette and the entire EPR team. This shows that when you have a really well-crafted emergency response plan and you practice it as appropriate when an emergency happens, you can put it into place really well. And the fact that JCPH was able to offer assistance to our neighboring counties, but they also had such good plans in place that they didn't need a lot of our assistance during the immediate event, but we're still able to now assist them during the recovery. I think it just huge kudos to the EPR team for just always being so well prepared.
Thank you, Dr. Comstock.
All right. And next is the student project regarding vaccination. So Nikki and Donna.
Hi, everybody. It's going to just be me today. Donna had a work conflict and was unable to make it. Donna Tan was she did a contract with us for, 4 or 5 months, and she did some incredible work. I hope that I can do her work justice presenting on it today. Just for anybody that doesn't know me, my name is Nikki Wellender. I have been on staff at JCPH for the last 5 years, and my last day was actually this past Friday, but I will be staying on to do some consulting work for a little while to help through some staffing challenges. So I'm going to try to share my screen, and if you don't see it in a second, I am so sorry.
While Nikki's pulling up that screen, I'll just input here that Donna Tan is actually an undergraduate student in the public health program at University of Colorado, Denver. So this was a wonderful opportunity for a student to get some real life experience working with our JCPH staff.
All right, it's Lindsay, I'm going to email you my presentation really quickly. It's not allowing me to share, but I can give a little bit of background while I send that email over, if that works for you, Lindsay.
Yep, go ahead.
Give me 1 second while I actually send the email so that we don't miss that part. All right, Lindsay, it's on its way over to you. It's not on its way over because it's still attaching. Technology is awesome when it works. So I'll just give a little bit of background as I believe that we've shown on this call before. Our team put together a campaign targeting youth ages 16 through 29, youth and young adults ages 16 through 29, knowing that that was an area that the data was showing was lagging in vaccination rates. We saw that it wasn't just because of the delay in availability of the vaccine for that age range. The uptake was proportionally slower. In addition, we did a literature review that indicated that for folks ages 16 through 29, there was much more of a mentality that indicated they wanted to wait and see, kind of see where vaccine uptake went and what the best steps then would be. So we wanted to make sure that we were getting out in front of this, communicating well to this age group, and being really responsive to the barriers and motivators that they identified. That is about as much background as I can give without some slides. Lindsay, if they're having any trouble, I can wing it. Haha, that's my presentation. We're there. Lindsay, you can go to the third slide if that works. All right. Thank you. Oop, back one if you could. Awesome. So the first thing that we did as part of this research was, as I mentioned, we did a literature review of 9 different academic, scientific, or peer-reviewed sources. And we came to some important conclusions that helped shape the research that we did moving forward and the eventual campaign. And those were really that social norming is an effective communications technique, especially when you're talking to youth and young adults. Showing the benefits of vaccination beyond just you're not going to get sick. The benefits of life, the social benefits. The messenger matters. We needed to make sure that what we were creating was co-created and was disseminated by people who were part of this target audience, because otherwise it wouldn't ring as true. We also explore the potential of using community influencers. That came through as a really strong finding in our research. As well as emphasizing personal choice and agency, because we know that the vaccination is a difficult decision for a lot of people. So respecting that while still giving all of the information and addressing those motivators and barriers was important, as well as addressing identities and the different barriers and motivators that may be there for people of different identities. We can go to the next slide, Lindsay. Thank you. So after that, our first step, and this is where Donna started with us and was able to really take this and run with it. We created an anonymous survey that was targeted at youth and young adults ages 16 through 29. And it asked a number of questions around when the vaccine is available, do you plan to get it? Do you think your peers will get it? What do you think are the biggest barriers for your entire age group around wanting to get this? And what are your personal barriers? As Donna would absolutely point out, so I'm going to do her justice here and point it out as well. We designed this survey with a little bit of a flaw. We kept everything very open-ended on responses, which made the data crunching a little bit more difficult, but she did a wonderful job with it. The biggest success story here is that we had more than 7,000 responses to this survey. We have done some surveying before and we have never seen anything with this kind of response. Huge shout out to the partners that we have from School of Mines and from Jeffco Public Schools and all around the county who helped us get this out to the right audiences so that we were able to really understand this age group and what we could do to actually move the needle here. And I would just point out that this 7,000 responses that Donna has highlighted on this slide was 7,000 responses that were actually able to be analyzed. So we had several thousand more than that we ended up having to filter out because they weren't in the right age group or they didn't live in Jeffco. But we had 7,000 valid responses, which is huge. And it was a really great lesson learned for how to do audience research moving forward. We can go to the next slide. So some of the results from this survey, the top motivators for getting vaccinated, and these are coded because of the open-ended nature of the questions, was keeping yourself healthy and safe. And that was at 41% of our survey respondents identified that as their top reason, followed by keeping others in your community safe and being fearful or scared of getting COVID-19. Some of the barriers to getting vaccinated were the number one came in at concerns about safety of the vaccine. Some ambivalence came in at number 2 around, that came in at number 3 around feeling like, I'm young, this doesn't really pertain to me. And then some barriers to access. A lot of folks thought that the vaccines were going to be too expensive for them. So we had some really good data going into the campaign creation that was able to help inform what the messages themselves were. And we can go to the next slide. Before we actually dove headlong into creating the campaign, we did some mock-ups of some advertisements, and we had an input session with some of the young adults in our community to kind of do some message testing in real time. Huge shout out to our Communities That Care program. They facilitated and hosted this input session for us, and we were able to join and have some really meaningful conversations with 20 adolescents and young adults who live in the county, who really were able to say, hey, this message looks great, this one doesn't, and this is what really does matter to my age group. So huge shout out to the teams that were able to help us with that. And we can go to the next slide. So these are some of the campaign graphics that you may be familiar with. You may have seen them a couple of times. The second phase of the campaign was really creating it and getting it launched. We took all of the data that we found through our literature review, through our surveying, and through our focus group, and created a campaign that was responsive to the messages and the themes that were throughout. So then we did a really widespread dissemination of the campaign, including paid advertisements. We partnered with iHeartMedia to do radio ads and to have a wider web reach. And we did social media ads on Facebook, Instagram, Snapchat, and TikTok. This was our team's first time of using Snapchat and TikTok as advertising avenues, which was terrifying and exciting all at the same time. And as we'll see in a few slides, it ended up proving really beneficial. Those were the channels that were identified by the youth in the Communities That Care session as being the best way to reach people their age. And they really were. We were able to actually have some meaningful engagement with youth and young adults through the county. And we can go to the next slide. So these, as I mentioned a little bit, these are just the different channels that we used, including radio ads, and then the different Facebook and Twitter and social media channels that we use, including our own and the ones that iHeartMedia helped us identify. We also, the one thing I have not mentioned yet is we had audio streaming ads on Spotify and Pandora, which was a new avenue for us as well. We can go to the next slide. So then, after the campaign ran and wrapped up, we had the really fun opportunity working with Donna to evaluate the campaign. Similar to the survey that we sent out before we actually created the campaign, Donna worked to structure all of the questions to be mirror images of what we asked the first time. So did you get a vaccine? And what motivated you to get a vaccine? And we used all of the same channels that we pushed originally to make sure that this reached many of the same people that we spoke to the first time or their peers. We can go to the next slide. So as you'll see on this chart, which shows the percentage of residents who have received at least one dose of the vaccine through the weeks of the campaign, which is June 21st through August 30th, you'll see a pretty straight line upward. We saw huge increases in youth and young adults ages 16 through 29 who received at least one dose of the vaccine over this time frame, and it was exciting to see this strong of an upward trend here. And Donna crunched all of these numbers. She went through all of our vaccination data every week and pulled out what we needed for this age range and correlated it with everything that we found in our survey results. If we can go to the next slide. Social media was the venue that we saw the most impressions on. You'll see here that there was 1.7 million. I'm not going to try to read that number out loud correctly because it's not going to happen. 1.7 million social impressions. And for the entirety of the campaign, including our radio ads and our digital display ads, we had 2.2 million impressions. Our top two channels that received the most attention as far as engagements and impressions were TikTok and Snapchat. So very successful first showing for these. We can go to the next slide. And we did our post survey. So here's some of the findings. We had an increase in the number of respondents who said that they plan on getting their COVID vaccine from the first survey to the evaluation survey. So we saw an increase there, which of course is what we were looking for. And then the motivators and the barriers for getting vaccinated ended up being pretty similar from the first survey. And we coded them this time. So it was not just an open-ended response. But we did see that the top motivators for getting healthy were keeping oneself safe, keeping their community safe, not wanting to get COVID, and then just a desire to return to something a little closer to normal. And then some of those barriers, they remained similar as well. Concerns with vaccine safety, concerns with vaccine side effects, a little bit of ambivalence about whether or not it's necessary for the age group, and then some challenges. Rather than saying that they believe that there was a cost or any of these things, there were still some identified barriers for this age group, such as where the vaccine sites were located and transportation. We can go to the next one. So we had a total of, I can say all day long, the 1.7 million numbers, because those ones are really exciting. But based on the survey results specifically, of the people that took that survey, we had 1,335 people who said that they actually saw the campaign, which is exciting. And the top channels that they said they saw it on were Facebook, Twitter, and TikTok. So while Snapchat was a really high performer as far as engagement goes, Twitter came in as one of the places that people who responded to our survey said that they saw it, which just kind of tells us that our social media networks are really going to be the best place to reach our youth and young adults, and that using a wide array of strategies and channels is the best way to do it. We can go to the next one. So this is the most exciting part. We asked, did the campaign motivate you to get vaccinated? We had 707 people of that 1,300 number that said that they saw the campaign. 707 people responded to this question, and 629 of those people said that yes, this campaign motivated them to get vaccinated, which is an 89%. An 89% of respondents saying that. That is huge. And we typically don't get to see this kind of data coming out of one of our campaigns. We can hypothesize and say, oh, the vaccine trends went up, but we have actual data that says that our campaign was what helped people make that decision. We can go to the next slide. Couple of quick final conclusions. I've already went through these a little bit. And I'm so sorry if I'm talking a million miles a minute. I'm just trying to make sure I'm respectful of everyone's time on here. Social media, huge opportunity there to reach people in this target audience. Continuing to use TikTok and Snapchat, as well as the channels like Facebook and Twitter that we regularly use, is going to be really effective for this target audience. People really still value keeping themselves and the people around them safe, which offers us an avenue to continue communicating with this age group moving forward. This campaign, the big one, the glitter in the air and skywrite it, is that the campaign did contribute to an increased vaccination coverage among this age group, which that's all we can ask for, really. Surveying with a small incentive, we gave gift cards throughout the entire process. That showed to be a very effective methodology to getting people to actually engage with our work. Whether that was just telling us what their thoughts were, or actually telling us at the end whether or not they followed through with their vaccination. And as I mentioned, using as many channels as possible to saturate the market and repeat this messaging over and over is really key to making sure that you have behavior change at the end. So I think that I have one more slide. This is the easy one. Thank you for listening to me today. Donna, she wished she could be here, but she just couldn't get her schedule switched around. And since her contract with JCPH has officially ended, we wanted to be respectful of that and not ask her to do too much post-contract. But she knocked this out of the park. Every single piece of data that you saw in this was from her. She crunched all the numbers, and she really was able to help us see for the first time what a campaign can do when you are able to analyze it and see every step of the way. If you want to reach out to her, if you want to give her any kudos or shout outs, her contact information is there. Mine is there. I will still be sticking around for a couple months, so you'll still see me for now. And I think that's all I have. And if anyone has any questions, I am more than happy to answer them. Thank you, Lindsay, for manning the slideshow for me.
Nikki, thanks so much. You definitely will be very missed. Another outstanding effort. Board, any questions or other comments for Nikki?
just thank you for all the good work that you have done, Nikki, and your team.
Thank you so much. Everybody on the comms team is here tonight, so that means a lot. They were at least about a half hour ago. I believe that they still are, but I'll make sure that that gets passed along. And I know that Noella and Hope and Kirsten are still going to be working their butts off every day. So thank you for the thanks.
And I just want to say how impressed I was that the comms team, in the middle of all of the response to COVID and everything else that was going on, they still took the time and effort to mentor a student, number one, and number two, to do a formal evaluation of a messaging campaign that not only proved that it was effective, but also now gave us evidence on which we can base interventions in the future when we want to try to reach out to this age group. So it's just a wonderful example of using the scientific process to ensure that we're doing the best public health we can here in Jefferson County.
Thank you, Dr. Comstock.
Great. Next item is approval of the 2022 Board of Health agenda posting site.
Yeah, so this is really easy. Every public board has to approve a place where they post their agenda at the very first meeting of the year. Currently, you post on the Board of Health webpage, and your backup is, I guess, on the door of the Parfet building. Lindsay can correct me if I'm wrong. So if the internet goes out, you can post it there. And we just need you to approve it if you agree that that is still fine, or let us know if you have a preference of where this agenda should be posted for this year.
All right. Anyone have any concerns with our current process? Have we heard any feedback or input that our locations are not working? Certainly would hate to change it when people are pretty comfortable and know where they currently need to go to get our information. And our website seems like the most likely place that you should find that. All right. I'll entertain a motion to continue with our current posting process.
I will so move.
Second.
Any additional discussion? All right, all those in favor in continuing to post on our Board of Health site and on the Parfet building as a backup if technology fails, say aye.
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 Next item, nomination and elections for Board of Health President. I would like to nominate Sherry John as President of the Board of Health.
I would accept your nomination. Thank you, Mr. Vice Chair.
I'll second.
Any additional discussion? All those in favor, say aye. Aye.
Aye.
Aye.
We need a nomination for Vice President.
I move to nominate Lane as Vice President.
I would second that.
All right, any additional discussion? All those in favor, say aye.
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 Need a nomination for Secretary for the Board. I would like to nominate Kimberly to stay in that role as Secretary.
I would accept that role.
I'll second it.
Any additional discussion? All those in favor, say aye.
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 All right, I think we have completed our elections. Public comments. We will try to limit that to 2 minutes. Certainly have been here for a while, but appreciate those that have stuck around. I do want to mention, or Kimberly, I don't know if you wanted to share this. There is a lot of information on the Jefferson County website. So I really encourage folks, there are FAQs there, and we really want folks to go to credible sources of information. So as you hear testimony, there is a lot of information. We are not going to go in a back and forth with everyone that speaks, but there is a lot of information that you can get that Jefferson County has already created, CDC has created, the State Health Department has created. So we have loads and loads of resources that are available. So we will not spend time in back and forth discussions with each person that comments, but do want to let folks know of all those available resources. With that, let me try and pull up a timer. Thought I had one set. There it is. And Lindsay, if you can try to elevate our first person.
Yep, Marcy Tucker. And Marcy should be unmuted.
Marcy, feel free to share your testimony.
Okay, I know that she's on. And I'm trying to unmute her. I'm not sure what's going on there. Marcy, we can come back to you if you want to maybe raise your hand when you think that you have your audio on. Okay, and then the next person would be Shauna Keller. And Shauna, I've asked you to unmute.
I'm sorry, I actually submitted a written response, so I apologize if somehow I clicked the wrong button.
Oh, okay.
So, thank you.
I'm just trying to find the people. The next person is Christy Fig, and Christy, you're unmuted.
Hi, can you hear me?
Yes.
Great. My name's Christy Fig from Golden, and I'm addressing the board this evening about the current PHO requiring masks indoors in Jeffco and its off-ramp. When this PHO was established last November, the necessity of needing to do something to help our hospitals was discussed at length. This was pointed out repeatedly by Board of Health members as the reasoning for the mandate, yet the PHO off-ramp is not based on hospitalizations. If it was necessary to manage hospital capacity, then how is that same metric not involved in the removal of said PHO? If that was done in the private sector, it would be referred to as a bait and switch. These types of actions damage public trust. Dawn Comstock mentioned multiple times this evening that she works with other Denver Metro LPHs to ensure a level playing field for businesses. What she neglected to address is the unfair playing field between Jeffco and its direct neighbor, Douglas County. Jefferson County is suffering. You can see that in the county budget shortfall. Jeffco can't afford to continue to drive business out of our county, either purposefully by telling people to shop elsewhere or as an unintended consequence, given our neighboring county who is approaching this endemic virus with personal risk mitigation choices. It's time to stop chasing cases and drop the mandates. We need Jeffco Public Health to return to its purpose, which is to provide guidance. We are almost 2 years into this. Every adult has had the opportunity to be vaccinated. Every child 5 and older has had the opportunity to be vaccinated. One-way masking works. Everyone has the tools to be protected, and they can make the personal choice to employ the mitigation strategies that matter most to them. Yet JCPH continues to play old tapes and hold on to requirements to keep mandates in place. The sky is not falling in Douglas County, and despite the messages its leaders share, it's not falling in Jeffco either. We need to stop chasing cases and we need to drop mandates. As things change, we need to adjust our response. Thank you for your time.
Okay, next is Kathy Roboff. And Kathy, I've unmuted you.
Can you hear me?
Yeah.
Okay. I'm going to share with you a powerful public statement from a teacher because after 3 impacted school years, our kids are not okay. I am proud to be an educator. This is quoted. I don't claim to be a doctor. There's a lot I don't know, but I spend my days with our youth and they tell me everything. I have the on-ground experience that you won't find in a textbook. I painfully know the burden they are carrying. I'm sick of the push by many credible people to minimize their pain. I want to share what I'm seeing and hearing. Our children believe that they're responsible for the outcome of this pandemic. They have internalized the shame and blame that was selfishly placed on them. They believe that if they remove their mask, they will be responsible for the death of another. They want to be told that they can take it off and that it is not harmful to do so. They want and deserve answers. Someone tell them that they are not responsible for this tragedy. The unvaccinated feel shame when others talk about their status. They look down and shrink in their seat. They watch me to see how I react. I remind them that the conversation isn't appropriate. I stress that I don't care. All are welcome in my class, as they should be always. Many are angry. Those who did get vaccinated see very clearly that it amounted to nothing. They see that promises were made on behalf of their government, public health, and their parents that never came to fruition. A deep level of trust has been shattered. It destroyed them. They are lost. Kids' identity is made up of their social interactions. When all sports, clubs, and friendships have been severed, they wander aimlessly looking for something to hold on to. Often they stumble into drugs, alcohol, or fall into a deep depression with no way out. The level of hopelessness in our youth has reached its peak. They have verbalized that nobody is coming to save them, but they know they can't do this anymore. They have told me that no, I can't fix this, but someone has to, soon, before they give up. After hearing them say, I can't fix this, I responded like every teacher should. Watch me. I am their voice because they are voiceless. We have taught our children that they don't matter. When experts trivialize their pain, imagine what they are internalizing. But I am an expert too. I'm an expert in connecting with our youth and hearing their cries. They need normalcy immediately. History will not be kind to those who minimize their suffering and ignored their needs. I can go to bed at night knowing I tried for them. Can you? This is not their burden. They are broken. Fix this now.
Okay, next up is Bruce Strahan. And Bruce, you're unmuted.
Hello, can you hear me?
Yes.
Hi, this is Bruce Strawn from Arvada. I have 2 kids in Jeffco public schools, and I have some very good news and an announcement to make here. I have submitted an application for the open seat on the Board of Health and actually got it submitted in time. I'm a professional engineer. I'm an expert in HVAC. I've heard Dr. Comstock recommend some things there in regards to ventilation, air filters, UV lights, some things like that. I'm actually an expert in all of those. And she's right, those actually do work. I really would have liked to have seen Jefferson County invest in those kind of things instead of all those tests for asymptomatic people. With that said, I just a couple of things I'd like to mention. I'd just love to hear your opinion on a couple of things. One, the incident that occurred at Denver Christian School. It's actually not in Denver. It's in Lakewood, Jefferson County. The incident where 4th and 5th graders passed out during a choir concert when they were masked. I just wondered, do you have an opinion on that incident? Did it make you question the mask mandate? And another question I'd love to get your opinion on is the VAERS data that shows in 2021 about over 21,000 deaths from vaccines. In a typical year, there would only be a few hundred. And according to the CDC's disclaimer, this is the whole purpose of this is to be able to give you a red flag if there's some kind of an unusual pattern in vaccines. They call it a safety signal. I just wondered, would you consider that to be a safety signal? Thank you for listening. Hope to hear from you soon.
Okay, next up is Lorraine Levins. And Lorraine, you're unmuted.
Can you hear me?
Yes.
Okay. JCPH, I wanted to make a few statements, and these are recent statements that came out last week. The Pfizer CEO spoke out recently and said that, quote, the current 2 doses of the vaccines offer very limited protection, if any. 3 doses with a booster offer reasonable protection against hospitalization and deaths, and less protection against infection, end of quote. He also mentioned a new booster for the Omicron variant is expected to be available in March. Let me repeat, he said less protection against infection, even with the available booster, which means that the virus can still spread among vaccinated individuals. He confirmed what the general American public has already been observing since Omicron took over. Last week, the Supreme Court blocked Biden's vaccine mandate for businesses with greater than 100 employees. They acknowledged that the virus impacts everyone beyond at work, schools, and events. We have learned that we cannot stop the virus. Cloth masks are not going to stop the virus. Expecting everyone to wear more restrictive masks is completely unreasonable. Even Dr. Fauci and the acting head of the FDA, Janet Woodcock, said last week that the Omicron variant will infect just about everybody, regardless of vaccination status. For all of these reasons, we need to immediately end the vaccination passport mandates for all of our Jeffco facilities and events. These mandates are completely unjustified and discriminatory. Our son can't go to his practice indoors for soccer because of this. So we are directly impacted. This is just unreasonable, uncalled for. He's a healthy person. Why shouldn't he be able to go? So allowing these vaccine passport facilities to continue with the status gives a completely false sense of security for someone at high risk based on where we are now with Omicron. From a public health standpoint, the solution seems dangerous and negligent. I'd also like to request that the use of masks be optional for those who would like to protect themselves in schools and businesses. If it gives them a sense of security, fine. Otherwise, everyone in the
Please
general
wrap up
public
your
knows.
comments.
What was that?
Please wrap up your comments.
Okay. One other group that's suffering are working families with little ones. I'm hearing a lot of distress. They don't know what to do. They don't have reliable childcare because of the quarantines. We need to address this before more families are out of jobs. We're hurt.
Okay, and our last person is Mary Keener. And Mary, you're unmuted.
Can you hear me all right?
Yes.
Thanks. My name is Mary Keener and I live in Arvada. The biggest problem I see with the JCPH COVID response has been to make blanket requirements and mandates without reasonable exceptions. Our second grader is a student at a Jeffco music school. After being masked in school from 8:40 a.m. until 3:30 p.m. every day, she is also required to mask during her music class. It takes place in a large classroom where the 4 students and the teacher are easily spaced at least 10 to 12 feet apart. The owner was preparing to lift their voluntary mask mandate at the end of November because the vaccine had been made available to all students, but unfortunately the mask PHO was put in place before that could happen. At this point, 3 of the 4 families in this class are looking into other music options for their children because the masks are so burdensome to the learning process and there is just no end in sight. Also, I don't know how often any of you have done rigorous workouts while masked, but it is not a viable option for our 3 children. We have been driving 2 hours round trip 3 times per week for our kids to train for their sport in 2 different counties that don't place these restrictions on our children. Allowing mask exemptions for dining, but not for other businesses is unfair, especially for those who are willing and able to ensure social distancing and provide upgraded ventilation. Also, to the point that Ms. John brought up earlier, I have received Cora documents from JCPH, which included redactions of some names, but not others. When I inquired about the double standard, I was told by attorney Kelsey Hall that JCPH redacts names when it has received credible information that they may face harassment. Using Cora is a reason to require that fully vaccinated businesses be listed on the JCPH website doesn't seem like a valid excuse, or perhaps the previous Cora redactions were illegal. I'm not sure which. What I do know is that even as there is a growing consensus that the masks our kids wear are completely ineffective against Omicron, and data clearly shows the mandate has not worked, this PHO continues to hurt Jeffco businesses and children. Thank you.
Okay, and Lane, that was the last person I had on my list. Oh, and maybe Marcy's able to unmute now. Hold on.
Yes, thank you. My name is Marcy Tucker. I'm a Golden resident. It's hard to squish everything from the last 2 years into 2 minutes, but Yes, a few things I want to point out is, yes, a small victory for us workers from the Supreme Court on the mandates. I'd like to point out the Constitution and the right for pursuit of happiness. I feel that if the JCPH were to actually care about health, public health and safety, they would take into consideration the mental abuse, physical abuse, and all these other things going on right now. I feel that the public comments for the last year and a half have gone unheard. I think that there is a bigger agenda, and it does not include all the voices of the citizens. So hopefully the board and everybody will make the right choice and allow us to take risk upon ourselves. And I really wasn't prepared. It's been 4.5 minutes or hours for the meeting, but thanks for your time, and don't forget that there is a lot more risk than what you guys are focusing upon. Thank you.
Okay, and that's it for public testimony or public comment, sorry.
All right. Executive Director comments.
Yeah, thank you. I just have one item, and I did not put it on the agenda because I wanted it to be off the cuff, if you will. Just wanted to take a moment to, as the board knows, Margaret Huffman, Dr. Huffman has resigned from JCPH. She will still be a close working partner in her new role with Jefferson Public Schools, but this will be her last Board of Health meeting as a JCPH employee. And I wanted to really just take a moment to acknowledge and honor the long-term commitment that she's made as a public service servant in Jefferson County, the leadership role she's played at JCPH, and just to thank her for her time and her effort. Unfortunately, in COVID times, we're trying to honor people remotely, which is just not even close to what it should be. So someday in the future, when we can gather again, we will bring back everyone who has retired and moved on from JCPH, and we'll give them an appropriate send-off. I have asked Margaret if she is the kind of person that wants to ride off into the sunset quietly, or if she'd like a big to-do, and she said she'd get back to me. But since this is the last Board of Health meeting that she will be attending as a JCPH staff member, I did want to just mark how much she's meant to JCPH and give the Board of Health an opportunity if you have any comments for her.
I definitely do, because I missed the email until I think today. I was in the CalFO policy committee, and Shannon had mentioned that Margaret had taken another position, and I had not known that. So today has been a lot of shocks. So I wish you all the best, Margaret. You've been an amazing staff person and contributor to this community, and I know you still will be. But yeah, so I'm kind of still in a bit of a shock mode on that one. So, but I do wish you all the best, and thank you so much for all that you've done.
Thanks, Lane. And it's not exactly riding off into the sunset when I'm just going up the street. I'm going to miss you all. It's been a wonderful experience. Thank you.
So Margaret, I just want to say how glad I am that you aren't riding off into the sunset, and that you will be just up the street, and that you're sticking around in Jefferson County. And I want to recognize all the years of collaboration that you have been a part of in Jefferson County, and tell you how much I appreciate that. And I also want to say I love your new hairdo.
Oh, thanks. Got to get a new do with a new job.
I will just echo what my colleagues have said. You have put a lot of years into Jefferson County Public Health, and it has not gone unnoticed. You have been an asset, and they will be very blessed and lucky to have you over at the school district. And I know that you take a lot of expertise over there with you. But thank you for all of the years that you've given to this community and to the Jefferson County Public Health. You will be missed.
Thanks, Sherry. I appreciate it very much. I'm going to miss you all too. And I know that we'll continue to work together. The work in public health and public schools integrate nicely together. So I know that the work will continue. We do good things together.
Margaret, I just want to say thank you for everything that you've brought to the health department. It warms my heart to know that those kiddos and the teenagers and all of the kids and teachers and everybody involved in the school district will have you as their advocate. All the best to you, and we look forward to continuing our collaboration with you in your new role.
Thanks very much. Thanks, Kimberly. And thanks to everyone at Jefferson County Public Health. It's been an honor to work alongside you.
And I have no further updates for the board tonight. Thank you.
Right. Jim, if you're comfortable with pushing yours, appreciate that. We can move to staff comments. Any staff that have stuck it out? All right. Board of Health comments.
I would like to just make a comment. I just want to say to all of the board members and the staff and the directors and Dr. Comstock and the community and the community partners that I'm very excited and look forward to this next year serving as the next president and working with my colleagues who are all a delight to work with and have a lot of expertise in the areas that I don't. So I look forward to working with all of you. And thank you for your confidence.
Thanks, Sherry.
This is Kimberly. I just wanted to, again, just express my overwhelming gratitude to every single one of these names that are in front of me, whether you are a person of the public who called in and listened to the entire meeting, or the staff who did the work of the things that you heard. I think this meeting tonight, as long as it has been, illustrates the breadth of work this public health department is doing. Yes, we are concentrating on a lot of issues related to COVID and working together to move this from pandemic to endemic, and we're doing a lot of that work. But as you've seen, the work of Jim Murata's team and Margaret Huffman's team and Elisa's team, Joe, Jody, everybody, I hope the message that people get, having sat through 27 hours of this meeting, just kidding, I lost track of how long it was a couple hours ago, but I hope that what you can see is the dedication of Jefferson County Public Health and the care these individuals are giving to this community. Fire response, on-site water, all of it. And I just want to really express my gratitude to all of you and thank you for letting me be part of your board as we continue to move forward and find solutions to the things that are troublesome or not working or are great. So thanks so much.
Really.
So I just want to say ditto to everything that Kimberly just said. She said it so well, and I don't need to try and re-say any of it. And I want to thank the other three board members, all of you, for taking on the responsibility of being officers. And I look forward to not being the newbie much longer.
Thanks, Sherry. It was very well said, Kimberly, so I'm not going to belabor a meeting that's already been so long. I guess the only other group to thank specifically is the nurses and the healthcare providers. I've seen so much on Nextdoor and the trials that they have. And if you don't believe it, which sadly I've seen comments of people saying they don't believe that they're really struggling and how difficult it is for them. And that's the most probably atrocious thing that I've seen on the social media. And there's a lot of bad things out there, but the fact that people say things like show me the bodies or I'll believe it when I see it, it's like, then go volunteer at a hospital and see what it's like. Cause it's, these are the heroes, they are. And they don't have the choice to decide who they're going to help. They're helping as many people as they can. And it's way more than they have bandwidth and staff to deal with. So as polarizing as things like masks have been to people, go support your nurses. That should be what we should be focusing on, what people can do instead of all the things that they don't like and don't want to do. Go help your nurses, go help those people that have been suffering for years and years now. That's what we need to start focusing on. Kimberly, go ahead. You're muted, Kimberly.
I would be remiss, since I said those things and then you and Harriet both said you would belabor, for not also including Kelsey and Ben and those individuals who consistently are available to us to provide us with guidance regarding all the regulations and everything that we need to adhere to. So Kelsey, Ben, Kim, thank you also.
Lindsay, we can't forget Lindsay. She's the glue. She glues us all together.
The glue. Absolutely.
Great. With that, we will adjourn this marathon meeting. Thank you all.
Thank you.